Good afternoon. This regular meeting of the Leon County Board of County Commissioners is called to order at 3 p.m. sharp on March 9th, 2021. Today, we're honored to have our own Vice Chair Bill Proctor provide the invocation and the Pledge of Allegiance. Vice Chair Proctor, sir.
Heavenly Father, we thank you for life, health, and strength. We pray now your mercy, your goodness to prevail upon our hearts and mind. Be with this commission as we deliberate the matters of our community. We thank you for Leon County, its employees, its families, its struggling, as well as its thriving members. We pray, O Lord, your mercy during this time of COVID, that you will continue to help us to do those things which will keep us safe. For your presence, we ask to abide throughout this meeting. Our prayer. In Jesus' name, amen. Amen. Our Pledge of Allegiance. I pledge of allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Great. Thank you very much, Vice Chair Proctor. Before we begin, I wanted to recognize the county attorney. She wanted to present a slightly modified process on the time limit for 3 minutes for each speaker for a motion. Madam County Attorney.
Thank you, Mr. Chair. So this evening, in an attempt to disrupt the flow of the debate as little as possible, we're going to a visual aid format this evening. Dan Rigo, to my right, will be keeping time. When you get down to 30 seconds left in your time, he will raise the yellow card. When your time is up, he will raise the red card. Only if someone continues to speak will I then lean in and interrupt verbally. Okay, thank you.
Thank you, Madam County Attorney. Commissioners, we are now at our awards and presentations. Mr. County Administrator, would you please introduce the first and only item?
Thank you, Mr. Chairman, Commissioners. Before I hand it off to Claudia Blackburn for today's COVID update, for my part at this meeting, I will provide you with just some brief information on the latest round of the COVID-19 relief that's being considered by Congress, as I know you're probably all following, which is called American Rescue Plan. The latest round of relief, Commissioners, which totals $1.9 trillion, was passed by the U.S. Senate over the weekend, and the House is expected to hold a final vote on the bill today. As you may recall from your daily updates, the bill includes new funding for another round of direct stimulus payment, extended federal unemployment payments through September 6th, additional housing and small business assistance, COVID-19 testing and vaccine distribution, and more. Importantly, Commissioners, the bill includes $350 billion for states, cities, and counties to mitigate the impacts of the pandemic. Based on an estimate compiled by the House, Leon County's allocation is projected to be another approximately $57 million. This funding would be distributed in two tranches, with 50% being allocated within the next 60 days and the remaining 50% a year later. We are continuing to conduct a complete analysis of the legislation now, and based on the final bill language and the preliminary Treasury guidance, I intend to bring a report back to you all on its eligible uses, either at your April 13th Commission meeting or at the April 27th Budget Workshop. In addition, Commissioners, I wanted to note that the American Rescue Plan also includes another $20 billion for rent and utility assistance as separate categorical funding, separate from the $350 that I discussed just a moment ago. This is in addition, again, to the state and local funding, and it's also in addition to the latest round, current round of ERA funding that we're working on currently. As you may recall, during your January 26th meeting, the board accepted that $8.9 million in federal funding from the last round of the COVID-19 relief bill to establish the Leon County Emergency Relief or Emergency Rental Assistance Program. We've been working on that program, Commissioners, as we've kept you updated on, really around the clock with an all-hands-on-deck effort. And I'm prepared to announce to you that we'll begin accepting applications on March 29th. And of course, I'll continue to keep you updated and provide all the details to you on the program. And as always, we'll be promoting this assistance far and wide. And with that, as just a thumbnail, Commissioners, I'm happy to answer any questions or to hand it over to Claudia for her update.
Thank you, Mr. County Administrator. Listen, I want to be careful about unfairly raising expectations, but with the new COVID relief funding coming, might there be opportunities for us to take a look at using some of those funds for addressing some of the homelessness in our community? I know it's usually not wise to use non-recurring funds for operational expenses, but might there be some opportunities for us to look at that area?
Absolutely.
Okay, great. Thank you, Mr. County Administrator. I have Vice Chair Proctor.
Thank you, Mr. Chairman. Commissioners, I just simply want to say that the last round of funding largely was a menu that had been set. It came to us, and we really didn't get a chance to, we merely got a chance to approve what was given to us. I want to ask that once we've been given those parameters, those categories of which the money is designated, that I'm asking staff this time, as opposed to you all bringing us a set agenda, that that us commissioners have a workshop around the pool of money, the categories of which we can spend, that we might have more of a participatory role and engagement in designating some of those recipients of the dollars. I think it's very important, and though we have extraordinary staff, that if we won't, they sure will. But here's an opportunity on this go-around for our voices to be leading the charge in designating for our community where these dollars might go. Of course, our staff is going to help us, but I think that this list should be comprised first by commissioners and given to the staff. If modifications are needed thereafter, they will come back to us. But by every effort, it should be our turn to set the priorities of spending. And I'm asking Commission that we would do just that. So Vince, what I'm trying to say is, Vice Chairman and as a Commissioner, I think that before y'all bring us an agenda that everything is already spent up, give this Commission a chance to weigh in first. That's the ask.
Thank you, Vice Chair Proctor. Commissioner Dozier.
Thank you, Mr. Chair. I look forward to the discussion. Mr. County Administrator, thank you for the update. I know this is moving quickly, and we may have some good news today, unless I missed a news alert in the last little while, and it's already happened. So the only thing, Mr. Chair, that I wanted to mention is that I really appreciate the creativity. We can point to the microloan program through FAMU Federal Credit Union to use some of the stimulus money in a reoccurring fashion. And I don't know if those opportunities are going to be available to us, but we have done well locally providing our own stimulus while we've been waiting for the federal stimulus. And we know there's a cliff that's going to happen. The federal government's already talking about it. Congress is, with the unemployment running out later this summer. So for my part, I think looking at the ways that we can really help people throughout the year, if those opportunities exist, could be a unique opportunity. Ms. County Administrator, I see you nodding your head as well, Mr. Chair.
Sure. I would just to provide some response to that, Commissioner Dozier, Mr. Chairman, actually this round is a little different in a couple of ways, and I know we'll get into much more detail about it, but just to acknowledge, Commissioner Dozier, what you've said, it's actually intended to span a couple of fiscal years this time because it's due not to expire until, I believe, 24. And so it's intended to do that for fiscal relief over that period of time for the community, but also, again, this round can be used and is intended to be used for revenue replacement for the county over a period of time, understanding that the fiscal impacts to the county may take some time as well. And to respond to Commissioner to Proctor's thing, I would simply submit to you that just like last time, when we come to you, we'll be coming to you with the guidance, the parameters, and seeking your direction on anything that the board would like to do relative to the new round of the new program. Thank you.
Thank you, Mr. County Administrator.
I'm sorry, Mr. Chair,
That's right.
just the response. Excellent point about 2024. Thank you for that. And let's be clear, we are in a better position than a lot of counties because we've done our good financial stewardship over the years, reduced our debt service, other things. So we may have opportunities available to us that others don't. So I'm really looking forward to that. And Mr. County Administrator, would it be fair to say this is the Alan Rosenzweig extension? Because our staff has worked so hard with federal government to make sure they understand we need a little more flexibility in spending the dollars. So I'm just going to consider it Alan's doing and influencing Congress there because, you know, rolling out these funds in less than 6 months was just incredibly difficult for us. So I'm really looking forward to this, and I know you all are going to bring us a good set of options. Thank you.
Thank you, Commissioner Dozier. Seeing no other speakers in the queue, we'll move on to consent. Mr. County Administrator,
Thank you,
are
Mr.
there any items pulled from consent?
Thank you, Mr. Chairman. Commissioners, we have 2 items pulled from consent.
Point of
Oh,
order.
yeah, my mistake.
Claudia
Sorry,
Blackburn.
mistake.
You prompted me, and I was just ready to go. I forgot all about Claudia.
Sorry about that. Ms. Blackburn, welcome. Thank you for being here yet again.
Well, I'm not sure how to take that, Commissioner Minor. Maybe you're tired of hearing from me. I'll try to be brief, but good afternoon to all of you commissioners and Vince. So I think it's a brighter report today. So hopefully we can keep the smiles going for at least a little while. So this is not happy news, but as of March the 8th, we have had 28,673 cases of COVID-19 in Leon County residents. And sadly, about 1% of those have ended in death. That is 292 deaths. However, there is good news. We're seeing a decline in our positivity rate as well as the average number of cases each day. So for the last 2 weeks, February 21st through March the 6th, our positivity rate has been 3.46% with 57 cases per day. We have had 4 cases of the UK variant in Leon, and we'll continue to look for more cases and try to get more sequencing accomplished. Cases are disproportionately in the 18 to 34 year age group, with about 52% of the cases in that age group versus about 31% of the population for the last 2 weeks. Happily, the cases for the 65 plus population have dropped to about 4.9% versus 14% of the population. So that is good news. And hospitalizations have also dropped dramatically from the highest rate that they were of the pandemic following the December holidays. If we look at the distribution of cases in the Black community in Leon County, understanding that 32% of our population is African American, from the beginning of the pandemic, 31% of cases have been in African Americans, but 48% of the hospitalizations have been in African Americans and 35% of deaths. The hospitalizations seem disproportionately high, though we have no statistical test to verify that. In terms of the vaccine rollout, collectively, the healthcare partners in Leon, along with FSU and FAMU, have vaccinated 51,799 people with at least 1 dose, and that is 17% of the population. And of that, 32,851 have received 2 doses. So we are continuing our quest to vaccinate at least 80% of people 65 and over. Right now we're at 73%. You may remember that I said before we were at 75%. Well, the population estimates for 2021 have come out, so our population increased a few thousand, and so our percentage decreased as a result. Only 13% of those vaccinated are Black, and only 40% of Black 65 and over have been vaccinated. So we still have a significant gap to fill in terms of the numbers of African Americans getting vaccinated, especially the 65 plus age group. Efforts are underway to increase access to the COVID vaccinations in the minority community. We realize that to achieve equity, we need to assure additional resources are distributed in the Black community. In addition to outreach by Bond and Neighborhood Medical Center, there have been 3 successful clinics in the Black community immunizing over 1,000 people collectively. There were 2 first dose and 1 second dose clinics at Bethel AME and Bethel Missionary Baptist, and an additional church is scheduled for March the 19th, but I'll let them make that announcement. The second dose clinic for Bethel Missionary Baptist Church is projected to be in the next couple of weeks as well. The FAMU Al Lawson Center has been open since February 25th, 7 days a week from 9 a.m. to 1 p.m., specifically targeting the minority community. It is they take appointments, but it is also a walk-in clinic. And though it is not at capacity, they are steadily vaccinating a portion of the population each day. And I'm sure as people learn about it, the presence of the Al Lawson Center as a vaccination site, that it will pick up. So that's kind of the summary of the vaccine rollout. I did want to talk a little bit about some new CDC guidance that came out yesterday for people that have been fully vaccinated, because we've been asked many times, are there any changes for people who have been fully vaccinated? And up until yesterday, there weren't many. But I'm happy to say that there are a few additional things that have changed that I would like to report on. First of all, let me clarify what I mean by fully vaccinated. That means that it has been at least 2 weeks after the second dose, if it's a 2-dose series for the vaccine that you received, and 2 weeks after the first dose and only dose if it's Johnson & Johnson. So what has changed? So if you've been fully vaccinated, you can gather indoors with fully vaccinated people without wearing a mask. You can gather indoors with unvaccinated people from one other household, for example, visiting with relatives who all live together, without masks, unless any of those people or anyone they live with has an increased risk for severe illness from COVID-19. If you've been around someone who has COVID-19, you do not need to stay away from others or get tested unless you have symptoms. In other words, you don't have to quarantine unless you have symptoms. Unless you live in a group setting and you're around someone who has COVID-19. So that's a different situation. But for most people, they do not have to quarantine if they've been exposed to COVID-19, if they're fully vaccinated, and they can be with other people that are fully vaccinated without wearing a mask. So those are probably the big changes. And on the CDC website, it's easy to find, cdc.gov, and you can quickly see the section for people that have been fully vaccinated. It tells you what hasn't changed, which I'm not going to go into all the details, but basically, it's the same thing. Continue to protect yourself and others, wear a mask, social distance 6 feet, and try to avoid large gatherings. And still, the recommendation is to delay domestic and international travel. If you do travel, there are some requirements and recommendations that you should follow, and continue to watch out for symptoms of COVID-19. And if you develop symptoms, to get tested and see your doctor, or at least call your doctor. So that's my report. I'm happy to take any questions, and I'll turn it back to you, Vince.
Thank you, Ms. Blackburn. First in the queue, we've got Commissioner Welch. Commissioner.
Thank you, Mr. Chair. Thank you, Ms. Blackburn, for your report. I know we're all happy to hear some positive news. And as that positive news trickles in, so do the communications that I'm receiving from my constituents and members of the business community about our own policies and ordinances about mask wearing and things like that. I read somewhere that Dr. Fauci in the past couple of days had said that we needed to get down to around 10,000 cases a day in the country before we started rolling back any mandates or mitigating efforts. And I wanted to know, in your professional opinion, taking all that information, taking the new CDC guidelines, the lowered hospitalizations and all that information, does that help? Can you help inform us about any benchmarks that we might be looking forward to, perhaps late summer, early fall? What kind of a timeline, perhaps, if the trend continues in terms of guiding our policy as a county body?
I wish I could, but I really can't. I just cannot look in. My crystal ball is not that accurate. So at this time, I mean, it's a day-by-day thing, and as the guidance comes out from the CDC, that's what we follow. So I really cannot project at this point. I hope it's soon, but I don't know.
Yeah, Commissioner Welch.
So essentially, our policy is going to be guided by the CDC's guidelines on the mask wearing and all that kind of stuff. If I also heard today the notion that the CDC's guidelines didn't go far enough in encouraging people to kind of get out, still mitigate, but using the notion that you could kind of get some sense of normalcy, the more people that got vaccinated, the closer we get to herd immunity, to kind of use vaccination as an incentive to get people back to normal quicker. So essentially, you're just saying that our policy is going to have to be informed by the CDC's guidelines on opening or reopening?
Since I provide technical assistance, so the policy decisions are yours, but that is what the county has followed to this point, and also the public health advisory from the state surgeon general, and that hasn't changed. But you're exactly right. The more people that get vaccinated, the more people can visit together safely, and we get closer to herd immunity, and that's when I think things will change. So you're absolutely right that we should be encouraging people to get vaccinated as soon as their priority group is open.
And then one last question, Mr. Chairman. Thank you. I know I had communicated with you today about teachers in particular and how there was a difference between the state-run sites and the federal-run sites for teachers getting vaccinated. I feel like I had read that the governor was trying to figure out a way to kind of get on the same page because the state-run sites are not operating on the same availability as the federal run sites. Is there any indication that the governor might change his executive order to sort of line up with the federally run sites, which are broader in their availability?
All I can tell you is that right now there is a difference. The governor's executive order is for anybody that works in a school, K through 12, if they are 50 or over, or sworn law enforcement officer 50 or over. So that is what the state sites are able to do. And the federal sites, and in Leon County, that would be Publix or Walmart or Sam's Club. Those are the federal sites right now in Leon County.
CVS.
Other counties have large federal sites. At those sites, somebody that works in a school, any age, could be vaccinated. Same for daycare, preschool, they can be vaccinated, any age. And that has to do with President Biden's guidance.
Okay, thank you.
Thank you, Commissioner Welch. Commissioner Jackson and then Vice Chair Proctor.
Thank you, Mr. Chair. Claudia, a couple of comments and then a couple of questions. First off, the website, the leonfloridahealth.gov, is incredibly informative. The problem with that is that I think we're missing our target audience. When we talk about less than 40% of African American senior citizens, and we talk about the low immunization rate for Hispanic families in 32310, 1 out of every 4 families is Hispanic. I don't know how we can get that down to the street level. We've talked about this. I think we debate on it and talk about it at each meeting, and then I don't know that anything really ever happens. I would love for us to have a conversation about that at some point, because I think there are some rumors that need to be dispelled, things like the cost of vaccinations, having an insurance card, having a physician's note. All of those things are some of the things that I'm hearing from people that they are concerned about, the side effects as well. Is there any ongoing effort right now to address those two kind of underserved? You said 73%, which is really great percentages for our vulnerable senior citizens, but that's total. When you look at that and break it down, 40% for African American senior citizens, and even less than that for our Hispanic population of senior citizens. Is there any effort that we can either highlight or that we can, well, I look forward to the conversation hopefully tonight or in future meetings to somehow kind of close that gap? This is something that happens many times in many communities, not just through COVID, but we have learning gaps in communities where people that are economically suppressed aren't always high on their priority list, the homework and education that goes on each night. Some are suffering from trauma and going from job to job and couch to couch. So we have got to figure out how to serve those underserved people. You want to comment on that?
Sure, and I think it may be coming up tonight as well. I'll let Vince chime in here if so, but the Task Force on Education Engagement is planning on just the kind of outreach that you're talking about. So it may be door to door, it may be at the neighborhood level, because you're right, not everybody, we have a digital divide, not everybody has access to a computer, not everybody uses one, not everybody gets their information that way, and they need to hear information from trusted voices and trusted places. And that's really been the theme of what the Task Force for Education Engagement is focused on. And so there is work going on right now to plan. And I think we'll have to do some experimenting to see what works the best. Definitely the church faith-based clinics, they have attracted lots of people. And so that is one way, but I also know there are people that aren't comfortable going to a church, so we need to hit the streets, and it has to be the right people who are trusted to get the word out. So any ideas that you have, also because you're very experienced at working with underserved populations, we need all voices.
Ms. Blackburn, if you don't mind, Commissioner Jackson, one thing that I know the county administrator and his staff have been working on with Matt Cavell is an effort to address, I think, a big part of what you're talking about. It's a major issue, and we've been talking about it. But if I can refer to the county administrator and Matt, who might be able to speak to some of that.
Sure. Thank you, Mr. Chairman. And Commissioners, it's probably worth a reminder. There's so many aspects of all of this that have been ongoing and so many coordinated efforts. I'll just remind the board that you all approved not too long, I think 2 meetings ago now, a countywide coordinated community effort related to the targeting messaging in communities of color related to vaccine hesitancy and vaccine availability. Matt can discuss more of that, and I think and not just communicating over 1 or 2 different mediums, but across the spectrum of the media that's available to us. And Matt can discuss that a little bit more. Again, it's probably worth just a little bit of a reminder given all of the various efforts that are ongoing. And I just wanted to note, of course, so much more is being coordinated in real time. Claudia and I had these conversations just today with a number of other stakeholders on additional grassroots, boots on the ground efforts in the communities. But Matt, why don't you give us a little primer of where we are now with our community coordinated efforts?
Hours removed. We're just actually hours removed from having a large planning meeting with city folks, Temple from Bond, neighborhood, and other representatives about how do you shake every possible tool you have out of the toolbox to reach everyone wherever they may consume information. And so we know that right now we're at the population that has been most readily available to read media outlets or to conceive that information or to perceive that information. So now what do you do short of skywriting to be able to find folks where they live? And quite literally that involves a grassroots campaign, which is door to door with coordinated collateral that addresses and educates and eliminates concerns and barriers about getting vaccinated. It involves widespan outreach that is informed by data-driven models about where is the hesitancy, where do those folks go, and what media outlets do those communities consume, and how do you reach them in a way that's equitable and fast. And that's what we're doing. We're launching that effort, and it relates to print collateral, to face-to-face communication, to community influencers, all based around national CDC guidance about how you move the needle on vaccinations, given hesitancy from other campaigns. So we're doing it at the national, state, and local level in all the right ways. That will be hitting the ground and running just in the weeks ahead, and we're eager to get that work going.
Great. Thank you, Matt. Mr. Jackson, any
Yeah,
other
I'll be
questions?
brief, not to belabor the point, but more African Americans get COVID, more African Americans are hospitalized with COVID, and more African Americans are potentially fatal victims to COVID. Anything we can do to speed that up and not experiment too much and possibly get that information in the hands of people. The faith-based community, I think, is a stalwart of African American and Hispanic communities, and we have to reach out to those folks as well. I just don't think there's any time for complacency and wait for them to come to us. Just like Matt so well articulated, we need to come to them where they're at. That's it.
Well said, Commissioner Jackson. I think you probably have full agreement from the entire board on that. Next, we have Vice Chair Proctor, sir.
Thank you. I think Commissioner Jackson has said it well, has said it extremely well. And as these reports have come to us weekly, our staff have been on it, on top of it. We get information, weekly report. And I want to thank Vince for a Herculean effort. I'm very glad to get the report that Matt has shared. And, at some point, the point that Commissioner Jackson's just said, I try to anyway, the point he just made about the number of people who get sick and who die, African Americans exceed in all of those categories. I try not to blame Claudia Blackburn at all. I try not to ask questions that are impossible for her to respond to. But I am grateful that the county will accept our role to be the county for Leon, and that in joining the forces and providing the leadership that is needed. And unfortunately, even though Ms. Blackburn says that we are following the CDC guidelines, I guess that's since January the 20th, because our governor has never embraced CDC guidelines. It's just a lie. Our predecessor president did not embrace, in fact, did much to destabilize the credibility of the CDC. So that orbit with which Ms. Blackburn is our leader of the county's health is aligned and in the orbit of the state. And the clarity with which we need to address and combat COVID difficulties in this community are simply not at the state. So, commissioners, I think that what we do going forward, and it's a late date, and Commissioner Sims, I don't know about you, but I think one of the difficulties right now is the closure of African American churches is a infrastructure communication basis that it has not been there over the past year. That has undermined and has prevented a momentum and a orchestration that creates that whirlpool and that vortex that moves the thought, agreement, and the alignment of minds and hearts that this is what you embrace. I'm grateful that we got to move forward because we don't have that great vortex working. And so if we can expedite, Matt, the plan, because we still have none. I do want to ask specifically, and we do need a plan. And with what you said, the number of needles in arms, Ms. Blackburn, is there a needle count by the state bond community? Is there a needle count of needles in arms rendered by FAMU or by the county? Do you have a needle count that we're able to look at those locales? That's a question.
I do not have it right now. I can look to see if it's possible to pull such a report, if that's what you would like.
Okay. Ms. Blackburn, for a couple of meetings, and I've asked about the plan to vaccinate the 30 or so prisoners who are 65 years of age at Leon County's jail. I've still not heard from you, and I just for today wanted to ask for the third time, can you please tell us the plan and what vaccination efforts are occurring? And is there a protocol to address the prisoners who are under our custody? Can you, I mean, is it something that I'm saying that you're disallowed to share?
We are working with Bond in particular to look at the possibility of vaccinating in the jail. That's what's happening with the jail.
So Leon County's health department is deferring to Bond, the federally qualified health center, to do what our Leon County Health Department can't, ain't, won't do? Explain the dynamic of why are you looking to Bond community health when we have the Leon County Health right next door to the Leon County Jail? Why is there such failure to connect? That is a question.
I hear you. You want to be sure that the prisoners that the inmates at the Leon County Detention Center are vaccinated, and we will continue to work on that.
Ms. Blackburn, I am asking you, please vaccinate those who qualify at 65 years of age. Take them a shot. They can't come to you. Secondly, it's my understanding that next week, the person who runs our COVID response, one man, over 20 million people in Florida, but one person says now that if you're 60, you can be vaccinated. Is there a plan to address those who are 60? And while we're at the jail, can we also stick those who are 60 in the arm? Is there a plan to respond to the governor's lowering of the age requirement?
Well, at this point, we have had regularly scheduled clinics through the health department. TMH has had regularly scheduled clinics. FSU has been vaccinating. FAMU, all of the regular sites have been vaccinating. We are looking at, would it be more effective to collaborate and have one site that most people can go to, understanding that we still need to give people choices because not everybody's going to be comfortable going to one site. But we are talking about doing that. If we don't do that, we'll just continue to schedule people as we have been And with our community partners, we have successfully, vaccinated, I would say, most everybody that wants it. At this point, the demand has really softened. And so we're happy that the next group is opening up. So.
Our administrator, and I'm just my last question, I don't want to hog it, it'll be too long. Our administrator indicates that we will see a new round of funding, probably in excess of $50 million, close to 60. Is there anything to prohibit Leon County's health department from going mobile or leasing some mobile trucks and knocking on doors and getting a ground game that's more aggressive? Because everything that we're doing, I'm not a general, I didn't go to West Point, but for what I'm observing, Ms. Blackburn, is that Bond, TMH, they had a semi-mobile thingy at the Northwood Mall. The health department, these are static sites. You got to find these sites. You got to get a ride to these sites. You got to get can these sites become a little more agile and we're not people dependent on folk finding you all? And I think that Bond has a bus that can go and travel. Can our Leon County Health Department do something similar? And wouldn't this money, this new COVID money, allow y'all to lease a similar type bus to go and create a new plan to get on the streets and, as you said, hit the street? Can you do that?
At this point, the FQHCs, as you said, have that capability, and our plan at this point is to support them in that if they want to expand that. I don't know that there's a need for an additional vehicle. We do, work with them to go out and do mobile sites, but you have to have a certain number of people to make it worth the resources. It takes a lot of resources to go out and do a vaccination clinic. So all that has to be weighed. You also have to manage the vaccine, and hopefully that will get a little bit easier as we have more Johnson & Johnson. But it is something that we're looking at. And what Dr. Robinson has said is, you can have the mobile unit, but it still doesn't get you to where you need to go. At some point, you've got to park and then basically go by foot to where you need to go. We can do that without a mobile unit. So what you're saying is, how can we increase the outreach? And that is what this planning that Vince referred to with the task force, that is what we're discussing right now, how to increase that outreach.
Okay, my final comment is, I'm just based on what you said, Ms. Blackburn. You said that 13% of blacks have been vaccinated in our county. 13% of blacks have been vaccinated. You say you don't know if there is a need. If there is still 87% of blacks out there who have not been vaccinated, I'm not that good in medicine, but it's a whole lot of people who have not, and it seems like a need to me. And what could help facilitate the strategy is a street game. We need a different approach. I'm asking you all, and I'm asking you to develop a street approach. And if you can't, well, so Vince, what we're doing with Matt, let's move forward. We're going to have to do this.
Yeah.
All right, thank you.
Commissioner Proctor, I'd like to go back to the jail question because you have asked me that several times. I don't set the priorities for the state, and we have been told that we cannot transfer vaccine to the jail. So that is, and that it is a priority to that the population in the jail is not the highest priority. So those are the parameters.
I get that, Miss. That really. Let me tell you something. My son is in jail, and what you just said pisses me off because my son is in jail, and that he and other persons similarly situated are not a priority. I get that. Don't tell me that again. Do not ever tell me that.
And I have a family.
Just be
member
quiet. I don't want to hear anything else. Be quiet. Thank you.
Thank you, Vice Chair Proctor. Commissioner Dozier.
Thank you, Mr. Chair. It strikes me that we are coming up on 1 year since we shut down for spring break, and we had our last in-person meeting, I think, of the spring on March 12th last year. That was Blueprint. Ms. Blackburn, you and your team have done a remarkable job in one of the most difficult environments any of us can imagine. And I want to acknowledge that you said it earlier, you're providing technical support. The policy direction comes from the governor or on a local level from us. And that has put you in an incredibly challenging position. And I appreciate how hard you've worked to balance all of these different really important questions, like what we're talking about with the jail, that you may not have direct control over. The fact that we're leading in vaccines for vaccinating our senior population, even if we acknowledge, Commissioner Jackson, you had a great round of questions earlier, and I want to appreciate Ms. County Administrator, you, Matt, our team, the task force. We've got to get to those populations that aren't getting vaccinated, but you have done a great job with a really difficult situation in the last 2 months, and that there's demand at Bragg right now. That there's room to expand vaccines there, I think shows how efficient your team has been. So thank you for that. And that's actually, Mr. Chair, where some of my thoughts started. The teachers and first responders, this was a couple of Fridays ago. You're doing those Friday discussions with TMH and others, and I heard it actually on a Monday when it was rebroadcast on WFSU. So that's a great time to get a weekly update from you all. I think I heard you say you were working with emergency management and perhaps the schools as well to get lists of first responders and teachers and start to do that outreach when they were allowed to be vaccinated. So that was before the president made the change on educators, and I'm not saying this correctly, Mr. Chair, forgive me, but before he expanded it to all educators, there was no age limit. Are we still working to make sure that all our first responders and teachers have that information? Is that going through your shop, or is that working through others?
I'm sorry, are you saying they have the information about the availability to get vaccinated?
Yes, I think I heard you say you were coordinating in anticipation of the governor, and then now the president has opened up more vaccines, the ability for teachers and others to get vaccinated. So I'm just making sure.
Yeah, no, most of the teachers that are eligible through the state sites have been vaccinated.
Okay.
Everybody that has wanted it through the education system that qualifies. We had a special clinic for them last week. They've been getting vaccinated at various sites. So they're all, I think, well aware of it, including the private schools. We've reached out to everyone. Firefighters, most of them had already been done because they're paramedics, and then sworn law enforcement officers, we had a special clinic for them today, and again, they've been going to different places. So I think they're all very aware. What's been confusing is that the federal sites have different parameters. They don't have the age restriction, and they also cover daycares, preschool, and so people who don't qualify for the state sites can go to Walmart, Publix, or Sam's Club within Leon County.
Thank you.
Or another county that has a federal site, yeah.
Or another county, right, that has a federal site. So yes, I'm picking up, Commissioner Welch and Jackson, you both know a lot better what communication is coming directly to folks at the schools, and I appreciate your questions there, Commissioner Welch. This was just something that I thought you were really focused on. And when we circle back to the jail, if we are making sure that our law enforcement personnel, for example, are vaccinated, as many as possible, that in itself will help anyone who's staffing the jail going in and out. Is that right? I mean, it's not the best. We wish we could vaccinate everyone, but that will help mitigate the spread. Is that correct?
Yes. Yes, absolutely.
Okay. Well, good. Well, Mr.
The medical staff has been vaccinated as well. So.
That's great. Thank you for adding that. Mr. Chair, I'm going to wrap this up here. I had a couple questions about the task force and the planning efforts, but Matt, you already answered those. I'm really glad. I know you've been working hard. We've all done little bits of the PSA and other things. I'm looking forward to seeing those. I'm sure our volunteer, Leon, if you need boots on the ground to go out and go door to door, we're going to be all in as a community, as the sheriff might say, not to steal his phrase. And the questions about masks, I was also going to ask that, and I really appreciated what you said about clarifying the new CDC guidance that we just got this week, and that the rest of us still need to be wearing masks and practicing all the same social distancing. This is getting very old after a year, but I think we're seeing the light at the end of the tunnel. And I think it is significant that our positivity rate is continuing to decrease, and that's because we are all taking the steps that we need to take. And I just wanted to say another appreciation to our businesses and schools and others, but the businesses that are really maintaining the policy have taken the brunt of this. And I would normally share something like this for comment time, but I think it's more appropriate right now. My mother turned 70 last week, Noreen Cardia, and I would normally give her a little shout out as we do in comment time. But she had received her second vaccine a couple weeks ago. My sister and I were tested, and I can't tell you what an incredible experience was to give my mother a hug for the first time in a year for her birthday. And the steps that we took just to give a birthday hug really shows, I mean, I know so many families are doing this, but the steps we're all taking to take care of each other. And that really stood out to me this weekend. So thank you again for your efforts. And Mr. Chair, that's it.
Thank you, Commissioner Dozier. Now, this is probably perhaps the most important agenda item we have, I understand, and we need to take the time we need. I do just want to be mindful, I ask everyone to be mindful of the time. We've been here for almost an hour and haven't gotten to consent yet. So just want to be cautious about that. I don't want us to shortchange the discussion, which is very important. As I just said, this is perhaps the most important issue, but I do want to remind everybody about that. I just spoke with the county administrator. I'd like to give him a minute or two to kind of talk about some of the efforts that the county's doing related to this discussion. And then I have after that Commissioner Maddox and Commissioner Cummings.
Thank you, Mr. Chairman. Commissioners, I know we overwhelm you with information, and especially in this area of all of the efforts that we have ongoing. This conversation made me think that it's probably one where I could provide just a little additional clarification. Some concerns have been expressed, very appropriate concerns about not taking our eye off the ball where our targeted efforts are concerned to the African American community, communities of color that are disproportionately affected by COVID. But I think, sometimes we get into these conversations and it's worth just a little bit of a reminder. And I was writing down a couple of notes while we were talking. And again, I think it's just worthy of clarification for the board and anyone listening. The board, we've been through various steps of the process here, and we'll continue to do so in the weeks and the months ahead. But as you know, we started off with the first round of COVID, and we started off with individual assistance, utility payments, payments to people that were facing foreclosure, payments to people who were facing a hardship related to rent. The great majority of those dollars went to communities of color, and they should have. That's where they were appropriately going to. We also started a small business program. The great majority of those dollars were targeted intentionally to the African American community, and that's where the great majority of those dollars went. We've been through rounds of testing, pop-up testing. We've targeted our testing and our pop-up testing to communities of color and put an awful lot of emphasis there. We created a micro-lending program specifically for communities of color and minority community. We have funded our community human services agencies. Much of their efforts have gone to the communities of color and those communities hardest hit, and appropriately so. We've provided, I think at last count, about 4 million meals in the community. Those have gone primarily to communities of color. We've created a voucher program for childcare, the great majority of which has gone to communities of color and those hardest hit. We now are starting a targeted communications plan as we go into vaccinations and go into that next mode. And we've allocated dollars, specifically very considerable dollars between the city and the county to target communications related to vaccine hesitancy and vaccine accessibility. And I don't want to preempt, and I won't preempt Commissioner Cummings, but I think we'll have a conversation on an upcoming agenda item here that her and I have discussed. And as that will contemplate as a bridge to get us to the next round of federal funding, as we have exhausted almost all of our existing CARES funding, but to identify some additional resources to get those boots on the ground, again, as a next intentional, appropriate step in the process to help assist connecting people that live in communities of color to the vaccine. And again, I just wanted to provide just a little bit of a rundown there because I think with all of the individual conversations that we have in efforts, it's important to sometimes remember sort of the big picture and all the efforts that we've undertaken to address exactly the issues that you all addressed tonight and will continue to do so. So thank you, Mr. Chair.
Thank you, Mr. County Administrator. And with that, I've got Commissioner Maddox and then Commissioner Cummings.
Mr. Administrator, thank you for running down all the efforts that we've taken to invest within the minority community. And I'm proud of the work we've done as a board to do such. But I gotta admit that first, Ms. Blackburn, I wanna apologize for my colleague's response. But I think you can understand his emotion behind that response, given the situation he's in. But I gotta say myself, man, my heart dropped when you said that those that are incarcerated or in our jails is just not a priority for our state. And I don't blame you because you didn't create that policy. So, but I can say that it made me think of when 3/5 was a standard by which people who look like me were looked at. And it made me wonder if you could finish your statement a little bit to talk about, not necessarily about not being a priority, but about what we can do to help those that most may not see as a priority. And this is not too, I don't think we've addressed anything in that way, Vince, as far as the investment that we've made in the community. But when you think about my mom, cousins, nephew, they're still human beings, but they've all been incarcerated. So if you could, again, just, I guess, I know it's a policy thing, but if there was anything that you would recommend that we do to kind of try to nudge our state in the direction of looking at those human beings as human beings, what would you recommend or suggest?
I'm sorry, are you asking me?
Yes, ma'am.
We will find a way to vaccinate the people that want to be vaccinated and are eligible. It probably does maybe make sense to wait until after Monday when it drops to 60. We will find a way to do it. I definitely want to vaccinate the population in the jail that qualifies and wants to be vaccinated. There's no question. We thought we had a plan, but it has not worked out. So we will find another way. And I'm sorry if that didn't come across.
No, thank you so much for saying that. That means a lot. I think Commissioner Proctor's probably listening. It probably means a lot to him too. Vince, as we continue to invest in our communities, Commissioner Jackson brought it up. Man, a lot of what we've done has helped to kind of close the gap financially, in need-wise in those communities. But you know, as much money as we invest, making sure households are able to eat and do those types of things, I think it's more important that we make sure that they're able to live by way of having a vaccine. And so I'm proud of what you're talking about, what Matt is talking about in becoming more mobile and being more aggressive and going into those communities and making sure that they are right there close to being able to walk up and get the help that they need. So I don't think that Leon County itself has, well, I will say that Leon County itself has done an excellent job in trying to deal with this pandemic And we've gone as far, we've even pushed the envelope sometimes on how far we could go. But it's good to know that we're pushing it even further, because for some people, this is life and death thing, right? The last thing I'll say is, when you talked a little bit, Ms. Blackburn, about the freedoms that come with taking the vaccine, with being able to gather in groups and things of that nature, the thing that popped into my mind, and it was probably something that probably shouldn't, but is this more incentive to get more people to actually take the vaccine? Or is it really factually safe to put yourself in these situations? Meaning, if you take the vaccine and you want to take off your mask when you're with other people take the vaccine, can you confirm to me that people can literally feel safe and that this isn't just an incentive to get more people to take the shot, Ms. Blackburn?
I can tell you that my experience with the CDC is that they don't create guidelines as incentives or anything that's not based on science. And so I believe that they, that at this point it's science driven, and but it also, is an incentive. So I don't think it was done just to be an incentive. But
Thank you, ma'am. My last comment, my final comment is that make sure that, I think somebody said it earlier, they said trusted voices and places. I believe it was you, Ms. Blackburn, who said it. I think that's going to be important as we move forward with trying to get this vaccine out and trying to get into minority communities. I'm committed to doing what I can to make sure I'm a trusted voice myself. So thank you, Mr. Administrator, for clarifying everything that we've done. And thank you, Ms. Blackburn, for your commitment to those in our jail. And thank you, Mr. Chair, for giving me the opportunity to speak.
Sure. Thank you, Commissioner Maddox. And I think, Ms. Blackburn, you can count on pretty much all of us, I think, to help you in whatever way we can to help get the word out for folks that want the vaccine and are eligible for it.
Thank you.
Thank you, Commissioner Maddox. We've got Commissioner Cummings, and then I'll wrap it up.
Thank you, Mr. Chairman. We appreciate you, Ms. Blackburn, and all the work that you all are doing to address the pandemic. And I believe the last couple of meetings we have had a dialogue, and I have asked specific questions about what we are doing, what the health department is doing to address the disproportionate effect of the pandemic on communities of color. And also, I believe at the last meeting, we talked about the reluctance of individuals in the communities of color to become vaccinated. So I believe I share the sentiments of my colleagues here on the dais regarding the adverse effect on the communities of color. I appreciate the county administrator and his analysis and synopsis of what the county has done over the last year in conjunction with the Leon County Health Department to address those disparities. But one of the things you mentioned is that you're planning a meeting, and you mentioned bond community, you mentioned neighborhood health, and the faith-based community to address some of the issues. Specifically, I hope the fact that members in communities of color are being vaccinated at a lesser rate. So my question is, do you have a date for that meeting, and will the issues that we are raising here today be addressed at that meeting? Is that the target? Is that the purpose?
So there have been several meetings, and I believe there's one that is going to occur tomorrow to do some additional planning and kind of nail down exactly what the plan is. The task force, and I don't want to preempt Vince. He may want to talk about this a little bit more, but the task force has a plan. They're asking for funding for that plan. We're talking about how to do that, how to bring that plan alive, what that's going to look like, and I believe that there's a meeting tomorrow to talk about that. And also, my understanding is that FAMU has received some funding to do focus groups to really better understand why people in the Black community and Black and brown people are hesitant to get the vaccine, to be sure that we really understand and aren't just, guessing. And so that information will help inform strategies to do outreach and hopefully turn things around one person at a time.
Thank
I
you.
don't have a firm date for exactly when it's going to start.
May I
Yes, Ms.
just have
Cummings, you have a
one
follow-up
brief
question?
follow-up? Yeah, thank you, Ms. Blackburn, for that response. Will there be any efforts from your office or any of the other local healthcare providers to determine whether or not your efforts have been effective or not? In other words, will there be some analysis and statistic to show whether or not your approach is working or not? Is that part of your plan?
I would hope that it's part of whatever plan is funded. Definitely, we're looking all the time at the numbers that I report on. Those are the numbers that I have access to. We're looking to see the number of people who have vaccinated, and that's really the outcome that we're after.
Thank you, Mr. Chairman.
Thank you, Commissioner Cummings. Ms. Blackburn, thank you very much for meeting with us at every meeting for the last year to talk about the community's status on the pandemic. I really appreciate it. One thing that I'd mentioned to some folks a few days ago at the TMH Facebook community conversation was what CDC Director Walensky said a few days ago, which was that now is not the time to stop wearing a mask. And she also talked about how the next 2 or 3 months really could determine what we end up being able to do come summer. If we continue to follow the main safety precautions, wearing a mask, washing hands frequently for 20 seconds, staying that 6 feet, that one alligator away from each other if you don't live with people, and then also trying to avoid large indoor gatherings. Those things, if we continue to do those for just the next 2 or 3 months, we may be able to relax some of these safety precautions that we've been living under for so long. If we relax too early, we may have that post-spring break surge, which might be similar to what we had after Christmas. So I wanted to make sure, we had talked about this at the TMH community conversation, but I wanted to kind of mention that again here. Would you qualify any of that with what the CDC director said the other day?
I would just echo what you said. You do a great job of giving that message, and that is absolutely right. We need to continue to be vigilant and continue to wear our masks, socially distance, wash hands, and get tested if there has been a possible exposure or signs or symptoms of COVID.
Great. All right, Ms. Blackburn, thank you very much. Really appreciate your time today. Next, we'll move on to consent. Mr. County Administrator, are there any agenda items pulled from consent?
Thank you, Mr. Chairman. Commissioners, we have 2 items pulled from consent, item number 11 and item number 13. Item 11 pulled by Commissioner Minor, 13 pulled by Commissioner Dozier.
All right. Is there a motion to approve consent aside from items number 11 and 13?
Mr. Chairman, can we pull number 15?
1 second. Motion's been made and seconded by Commissioner, you made the motion, Commissioner Dozier. Did Commissioner Maddox second? Okay. Motion's been made by Commissioner Dozier, seconded by Commissioner Maddox. All those in favor of the motion to approve consent without items 11 and 13, say aye. Aye. All opposed? Okay, motion carries. And I should have recognized this first. Vice Chair Proctor, did you have a comment you want to make about one of the agenda items on consent?
Mr. Chairman, I wanted to talk about item 15, but I'm perfectly okay with our moving forward.
All right. Thank you, Vice Chair Proctor. Appreciate it. Mr. County Administrator, would you please introduce the first item pulled from consent?
Thank you, Mr. Chairman. Item number 11 is the second performance agreement and surety device on the Fletcher Oaks subdivision phase 1. This was pulled by yourself, and I will defer to you.
Thank you, Mr. County Administrator. Are there any members of the public who would like to speak on agenda item 11?
We have none.
Okay. Thank you, Mr. County Administrator. I requested item 11 to be pulled from consent because my wife works for a real estate brokerage firm that has agents with property sales contracts in the Fletcher Oaks subdivision. My wife will not receive any commission from the sale of these properties, but there could appear to be a voting conflict. So upon consultation with the county attorney, I've determined that the appearance of a conflict in this situation is sufficient to abstain from voting as provided in Florida Statute Section 286.012. So I will abstain from this item. Would anyone like a motion on this agenda item 11? Okay, motion's been made by Commissioner Maddox, seconded by Commissioner Dozier. All in favor of the motion as stated, signify by saying aye. All opposed? The motion carries unanimously, 6-0 with myself in abstention. Mr. County Administrator, would you please introduce the next item pulled from consent?
Thank you, Mr. Chairman. Commissioners, item number 13 was pulled by Commissioner Dozier. It is a master's thesis disguised as a status report on broadband access to rural communities. I'm giving Heather Peoples a hard time. She did a great job on this item, and we're happy to answer any questions that you might have.
Thank you, Mr. County Administrator. Are there any members of the public who would like to speak on this item?
We have none.
All right. Let's see, Commissioner Dozier.
Thank you, Mr. Chair. I want to acknowledge we have an amazing staff that writes incredible agenda items all the time. And for Mr. County Administrator, for you to note this one as a dissertation, really, I felt the same way. I want to thank Heather for her hard work. I learned a lot in this item. So bring us back, and I would try to keep this short, Mr. Chair, but if anyone else has any brainstorming or other comments, I mean, this is the deepest dive I think we've had on broadband in a while. I would love to hear other comments. This is an issue that I get emails about often. I'm sure as we have had children in school in the last year and all of us working on Zooms and briefings and others, we know a lot of folks who have challenges with internet issues in their area, even if one of the maps in the agenda shows that, hey, you've got access in your area. It doesn't always mean that you have good access and enough to do business, do your schoolwork. And that was one of the big things that stood out to me, was really understanding the different way of measuring broadband from the federal and the state government. And the fact that these measurements only look at fixed infrastructure. We're not looking at the mobile devices and others. So there's a lot of nuance here that was very helpful, Mr. County Administrator. It also just drove home what we've always said. Local governments have been boxed out of this, and boxed is probably too light a word, but we're on TV here, so I will keep my other thoughts to myself with this. We have been locked out. How about that? Locked out of any work on broadband from the local government by the state and federal governments. On the other hand, there's a lot of movement, a lot of discussion from our state and federal partners right now. Senator Osley had a bill, and I think we could see some movement, and I really hope that, I know it's on our legislative priorities, but I really hope we see movement at both the state and federal level, and I hope our community will kind of respond to that. I'm glad we're going to promote the Test IT app. That's something NACO had, and our shop is going to promote that. I think that will be good to get a sense that's something where people can test their speed on their phones through an app and help to build kind of a crowdsourced map. So that's the kind of general picture here, but I'm still looking for, I'm still looking for any other creative ideas. And the two thoughts that came to mind, one is kind of wondering how many of us get emails about broadband at different times, or particularly in the last year. Looking at the map, I'd say this is an issue for all the districts, and whether or not there might be a discussion. Mr. Chair, I'm at my 3 minutes. May I have
Is there a motion?
motion to extend?
Second? Motion was made by Commissioner Dozier, seconded by Commissioner Maddox to provide Commissioner Dozier with more time. All those in favor of the motion, say aye. Aye. All opposed? Okay, motion carries. Commissioner Dozier.
I don't think I'll need 3 minutes for this, but thank you, Dan. The red and yellow cards are working. We had a presentation from DEO, a representative from DEO, about their strategic plan at the Planning Council meeting, and that was helpful. But I'm wondering if after session, we might have an opportunity to dig into this, to reflect on any changes at the state level, what might be happening at the federal level, but really make sure that we're taking advantage of the new federal programs and pushing them out to our community. The other question I had was, we just had a big agenda item on the Southern Strategy area. That's coming back in our comp plan. And one area of this map really stood out. We've got the neighborhoods, Seminole Manor, Providence, and Callan. I think that's District 1 and 2. They surround a really good spot with great broadband, and that is Innovation Park. But all of those neighborhoods are in a category where they don't have good access. I'm wondering if there's a conversation we can have with the private sector that may, and I'm speaking out of turn here, I have no idea if there's anything that we could connect to Innovation Park or anything else, but I'm looking for strategies here because we have been locked out of this. And those are my thoughts for today, Mr. Chair. I'll make a motion to accept the report, but I would love to hear any other comments if you all have been thinking along the same lines. Thank you.
Motion's been made to accept the report by Commissioner Dozier, seconded by Commissioner Maddox. I've got in the queue Commissioner Jackson and then Vice Chair Proctor.
Thank you, Mr. Chair. Just a quick shout out to county staff through a partnership over the summer, actually from March forward, arranged for mobile hotspots to be utilized by our Leon County School Board in the direction of Rocky Hanna, as well as the Leon County Schools Foundation. Also, the parking lots and the availability of the broadband that was available in our satellite library complexes was extremely important for our students that were somewhat disconnected in those rural settings. So kudos to county for working on that partnership with Leon County Schools and Leon County Schools for providing it to kids that need it the most.
Thank you, Commissioner Jackson. I've got Vice Chair Proctor and then Commissioner Welch.
Mr. Chairman, I sincerely appreciate Commissioner Dozier's comments. She spoke softly, but it was with a big boom. And the announcement that she has made speaks to the distribution of broadband. And I think that she points to the example of Innovation Park being immersed and very much connected, but neighborhoods right next to it very much in a third world reality. It's this kind of gerrymandered distribution of access to the worldwide internet that some do and others simply don't have it. And the geographic proximity of what Commissioner Dozier has lifted up for us leads us to all kinds of speculative conclusions as to why. As you all know, the city of Tallahassee disallows citizens in about 8 voting precincts inside of Capitol Circle and just on the other side from voting and being city resident. They're gerrymandered out. They're dense neighborhoods, urban area. The city don't want them. And here we find broadband access not available. And I think that we have a responsibility as a government to draw a line in the dirt and fight for everybody, everybody's access. Y'all heard the president, just like I did Sunday, talk about equality of voting and access. And H.R. 1 in the John Lewis bill in Congress dealing with voter access was not too much different. And Commissioner Dozier, you lift this point up, having the right to vote, having the right to the broadband, having the right to get a shot in your arm if by efforts that you make equally accessible, recognizing that no two people are created equal. This is something that we cannot blase just let slide, because the failure of broadband to be available in a community in this era is to create and foster neighborhoods that are separate and unequal. And those who are not motioned to for 2 more minutes, Mr. Chairman.
All in favor of the motion to... All those in favor of the motion to provide Vice Chair Proctor with more time, signify by saying aye. Aye. All opposed? Nay. Vice Chair Proctor, it's unanimous. Vice Chair Proctor, you have more time, sir.
And commissioners, we just got the draw the line in the dirt and stand up for something in the equality. I know all of our houses not made out of wood, and equal some of our houses made out of mud and straw. I get that. But when it comes to the equality of access of broadband, we got to have that. Otherwise, we allow for separate and unequal to occur. And I don't know, Commissioner Dozier, if just the motion was to accept it, but I think that we need to take strides to equalize the playing field. You would not want to buy a home in an area. I mean, the area is devalued. Young people go to a hotel and parents select hotels based on what kind of internet capacity they have. And you're not taking no children to a hotel for no week that don't have access. It's just not attractive. And if you don't have internet access, land value, property value, it just ain't the same. Nobody wants to live there in the third world without access. So that is how strong the point, you said with a light voice, but it's a boom. And I'm asking our commission and our staff to keep this at the forefront, because we cannot allow for structured inequality to go down in the capital county of our nation's third largest state, in the presence of 3 universities, and Innovation Park has it in the neighborhoods next door, cannot have it. Something is wrong. Thank you.
Thank you, Vice Chair Proctor. We don't want to limit discussion, but I just want to remind everybody, please keep your comments succinct and brief. Commissioner Welch and then Commissioner Dozier.
Thank you, Mr. Chairman. I'll be brief. I just want to echo Commissioner Dozier's sentiment about rural broadband access in District 4. We have a substantial rural area in the northeast part of the county, and Commissioner Dozier's district kind of mirrors that. And so I just wanted to go on the record and saying I agree. I would love to revisit it perhaps after the session if there's some kind of legislation that can impact it, or perhaps even CARES funding or something like that, because it is a crucial issue to access. And people don't think of my district necessarily as needing internet access, but we certainly have communities in the rural part of District 4 that need access. Thank you.
Thank you, Commissioner Welch. Commissioner Dozier.
This will be incredibly quick. I think we have shifted. The basic utilities are required. Counties have to make sure we have water, power, sewer. Communications weren't always counted as a basic need, but they really are now, whether it's telephone access, but also internet access. And that's really what we're talking about. These things have been separated, and we need the federal government and the state government to help us bring it back so that we are seeing this as a basic need for school, work, for our economy, for everyone. There is one option, Mr. Chair, I think I'll bring this up in comment time after session, and we can make a decision then as to whether or not we want to have another agenda item or look into this deeper. But if there is any comments about Starlink, I know some people in our community are already signing up. This is the SpaceX, and there's some studies showing that could really be a game changer for us. So I wanted to mention it now, and if there's more information we can bring into our community about that, I think it might be an interesting opportunity.
Okay.
Thank you.
Thank you, Commissioner Dozier. And also, just to confirm, your motion was for options 1 and 2, to accept the report as well as to adopt the FAC resolution. Is that correct?
Yes, sir. Thank you.
Okay.
Staff
And
recommendation.
Commissioner Maddox, as a secondary motion, you agree to that? Okay. Great. All those in favor of the motion as stated, in favor of options 1 and 2, signify by saying aye. Aye. All opposed? The motion passes unanimously. Thank you very much. Mr. County Administrator, we are on to citizens to be heard on non-agenda items. Are there any members of the public who would like to speak?
We do not have any citizens to be heard on non-agenda items.
Okay, great. Moving on to general business. Mr. County Administrator, would you please introduce the first item for general business?
Thank you, Mr. Chairman. Commissioners, item number 16 provides the board with an overview of the Leon County Sheriff's Office Real-Time Crime Center proposal for the development of a joint and centralized criminal intelligence information sharing center in partnership with the City of Tallahassee and with Florida State University. This item seeks board consideration to fund an equal portion of the Real-Time Crime Center as part of the upcoming FY22 budget process. In the spring of 2017, LCSO began an internal real-time crime center project to better assist area law enforcement in responding to calls in the community. And since its launch, the Real-Time Crime Center has been successful in assisting deputies leverage technologies to respond to incidents faster and more accurately. Recently, the Sheriff's Office reached out to the county, the city, and FSU regarding our interest in expanding the Real-Time Crime Center to facilitate a joint and centralized criminal intelligence information sharing center. And as detailed in the proposal before you, the expanded Real-Time Crime Center will support a more efficient and effective policing countywide. The project total cost of build-out would be shared equally between the county, city, and FSU. And if approved by the board in coordination with LCSO, the city and FSU staff would prepare a draft agreement for board consideration for the implementation of the Real-Time Crime Center project, including the finalization of the cost share commitments. And that information I would bring back to you, again, if approved by the board, as part of your FY 2022 budget process. And with that, Commissioners, we're recommending option 1, and we have no speakers on this item.
Thank you, Mr. County Administrator. Commissioner Welch.
Thank you, Mr. Chairman. Just a technical thing, and I don't know if this is just my packet, but the option in my packet, it seems to be like stated twice, one in the affirmative and one in the negative. Is that correct?
Yeah, I think it was a pagination issue. I think it's reflected as option 1 on the first page. So we were going with, again, option 1.
Gotcha. Option was, yeah, okay. So I'll move option 1.
Okay, and then Commissioner Jackson, I thought I heard you second. Is that correct? Like a preemptive second. Is that?
I made the motion. He made the motion. Commissioner Jackson seconded.
All right. Well, let's go with Commissioner Welch with the motion, and then Commissioner Jackson with the second. How's that sound?
That sounds great.
All right. I do have Vice Chair Proctor to speak. Vice Chair Proctor.
Thank you. As a budgetary concern, Vince, let me just ask, what source of funding, this is nearly $1 million commitment, does the United States Department of Justice, are they sending out grants to undergird the cost, or how exactly are you seeing us drawing to give on top of what the sheriff already gets?
Sure.
That this is a additional ask that goes well beyond and something that we did not anticipate.
Mr. Chairman, Commissioner Proctor, great question. And again, should this motion pass, we'll bring all of that information back to you during your budget workshops. But it is a very good and timely question. We think that FDLE's interest in the crime center, which they've stated considerable interest in this, is a good thing and portends potentially their interest in supporting this initiative with some state funding. As I've mentioned, the sheriff already has operating costs committed to this in his center, so we don't expect a major increased impact from an operating standpoint, but you're absolutely right. For the upfront costs, we will be contemplating and presenting to you how to fund that from general revenue this year, but we certainly would welcome any additional assistance from the state in helping stand this up. And again, we've had very productive conversations with them to this point.
Thank you, Mr. County Administrator.
Yeah, thank you, Mr. Chairman. This situation, you put some good words and new words on some of these things, and it sounds good. And a bad incident occurred, and we always get behind law and order. But the sheriff is taking leadership. We have a $48 million building out there off of Capitol Circle. And what is it about that particular building and what we had purposed it to accommodate that this new innovation comes to us? Vince, I'm simply without, because I thought we had the tip top of the top and the kitty cats meow with that building out there, consolidated, all of that. What makes this, why should I be emotionally fired up for this when we've put $48 million for the police, the sheriff, and all of that?
Mr. County Administrator.
Sure. Well, I think at a high level, Commissioner, and again, I think these are good questions. We had similar questions when we were first introduced, to this concept at the staff level. And again, should the board approve this motion, we'd be happy to get invite the sheriff's office to get much more into the nuts and bolts of this. But essentially, the answer to that is that the Joint Dispatch Center is pretty much at capacity, and FSU felt like it was important for their purposes to accommodate this space in one of FSU's facilities, and that was important to them. And so they have essentially donated the space. It needs to be outfitted and retrofitted and that sort of thing. But again, they have volunteered that space for this purpose, and it worked for the sheriff in terms of what his space needs are. And again, it didn't, for the best of our understandings, really fit in the existing public safety complex.
That is amazing. $48 million when we're out of space. The obvious here, it just screams out loud. The criminal justice area of Florida A&M is not at the table. I didn't see TCC's name, and it seems that this is a embellishment for Florida State's criminology program. The sheriff is leading the charge. It's housed at Florida State. I don't know if it's a teaching instrument, but we're taking the tax monies of everybody locally, and I'm pondering why FAMU's name is not on the sheet of paper as a sign-off, how they even involved. I think a measure like this we deserve to have seen the whites of somebody's eyeballs talking to us. This is innovative and different, and I think that this kind of ask should of necessity, we should have had those persons to come forward, I believe. Thank you very much.
Thank you, Vice Chair Proctor. Since we have no other speakers, we'll then vote on the item. The motion made by Commissioner Welch, seconded by Commissioner Jackson, was for option 1, which directs the county administrator to prepare a budget discussion item for this project. All in favor of the motion, say aye. Aye. All opposed?
Aye.
Okay, the motion passes 6-1 with Commissioner Proctor in dissent. Mr. County Administrator, would you please introduce the next item?
Thank you, Mr. Chairman, Commissioners. This item number 17, Commissioners, Leon County's budget process is designed to seek your early input, as you know, and guidance on policy matters, which then inform the development of the budget. This allows the board to make incremental decisions, obviously, throughout the process and to build the budget in a deliberative manner. This item before you now seeks your early your consideration of one of the early policy matters before the board, which is seeking your direction on the establishment of the maximum discretionary funding levels for the FY 2022 budget, including the CHSP process and special event funding. Commissioners, according to county ordinance and policy, the setting of the discretionary funding levels must occur prior to March 31st. Of each year, and the board's guidance received tonight is then used in the development of the preliminary budget. This item recommends maintaining funding levels for CHSP and the remaining non-departmental items. As a reminder, while we're recommending remaining the current levels of funding over the past year, Leon County has provided an additional $3.22 million in CARES funding for our community human services agencies, as they've taken on a lot more. In addition, the item provides a list of outside agencies the county regularly contracts with for specific services. As you're setting the maximum funding levels for CHSP, Commissioners, this is the time in the budget that if the board wishes to consider reducing any of these outside contracts for the purposes of increasing CHSP, which has occurred over the years, this would be the time to do that. Commissioners, following this agenda item, in preparation for future workshops, staff is currently forecasting revenues and developing and analyzing operating and capital budgets. In addition, staff continues to work closely with our constitutional officers prior to their formal submission of their budgets beginning in May. And following this agenda item, the board has scheduled, again, budget workshops on April 27th as well as June 22nd. At such time, we'll present additional refined revenue projections as well as seek your direction on any outstanding issues for including in the budget process. We're recommending, Commissioners, options 1 through 5, and we have 2 speaker cards on this item.
Thank you, Mr. County Administrator. Would you please introduce the first speaker?
Mr. Chair, while you introduce those speakers, I will be recusing myself for the item because I am over a nonprofit. Thank you.
Thank you, Commissioner Maddox. Thank you. Mr. County Administrator.
Thank you, Mr. Chairman. The first speaker is Leslie Powell Boudreau.
Hello, Ms. Powell-Boudreau. Thank you for coming. You have 3 minutes. Please state your name and address for the record.
Sure, thank you. My name is Leslie Powell-Boudreau. I'm the Executive Director of Legal Services of North Florida. My address is 2119 Delta Boulevard. I just wanted to take this opportunity, since we are one of the discretionary funded agencies, to talk a little bit about the work and what we've been able to do with the funding that you've given and contracted with us each year. In 2020, we had nearly 1,700 applications in our office here in Tallahassee and handled almost 2,000 cases. It's a mix of cases from family, which was the largest area, to consumer, to health, to juvenile. Certainly housing was a really significant piece of that. And some would say that because there was an eviction moratorium, we had fewer eviction cases, but that's not necessarily the case because there was so much uncertainty, so much lack of clarity about what moratorium applied to what and what those protections meant, that we've actually handled more cases, and many of them continue to be pending any extension of the moratorium or what may happen when it ends. Of those people that we've served, the households that comprise those cases, of the 4,500, almost 4,600 people we served, 1,800 of them were children. Really almost half, nearly a third, almost half, somewhere in that range. We've supported homeowners as they've tried to sort through forbearances and what that means under the moratoriums, and understanding what a loan modification may do to help them as they get back to work and are able to support themselves. We've expanded our intake and our interaction with our homeless service partners. We've worked closely with the county and other staff here to help get information out about rental assistance programs so that those who were facing eviction could access that, and we could help them communicate with landlords and actually make everyone whole as much as possible in that process. We've helped them get unemployment compensation and access to stimulus checks through the IRS that weren't given to them or were given to them in incorrect amounts. All things that are bringing money into the economy and helping encourage people to pay their rent, pay their bills, get things done within the community. We've been working directly with small businesses and other nonprofits as they maneuver the different and various COVID programs that became available. And the partnerships that we have, the critical partnerships that we have with every human service agency in the community, and with the support of organizations like UPHS, we couldn't do this without that collaborative effort. And if you see the community as it pulls together, it really has been amazing. We have not closed our doors during COVID. We've limited access, we've made sure we're safe, but we've been there for every emergency that's come in. And I appreciate this opportunity to talk about why this funding is so important, and hope that you'll remain committed to that statutory obligation. Thank you.
Thank you very much, ma'am. Really appreciate it. Next speaker, please.
The next speaker is Stanley Sims.
Mr. Sims, welcome. You have 3 minutes. Please state your name and address for the record.
My name is Stanley Sims. I'm at 1320 Avondale Way. Commissioner Dozier, we're no longer referencing the Southern Strategy. It's the Southern Action Plan. I want to talk about true voices. To you, true voices are the same people y'all get all the time. These are innovative times. What Mr. Commissioner Jimbo was saying, over in his district, there's a very low trust level there. You got working poor white folks, prideful, don't like folks in their business. I know that because I'm over there. I'm working with Mr. Shinkney on some very innovative strategies. Things like partnering with places they go, like the pawn shop. Buy here, pay here car lots, where they take their stimulus checks where their residence has to be verified anyway. They gonna call them and tell them when their payment is late. So why not tell them where they can help get their light bill and things? These are the strategies that me and your director, Mr. Shinkney, is working on, outside of the box strategies. So stop asking y'all. I know y'all think y'all important and everybody think y'all are only trusted voice, but guess what? I trust Miss D down at D's Kitchen, who I get lunch every day. I think the people would love to hear about Miss D getting a shot. I trust the people at the convenience store where I buy my lotto ticket. See, it's hard to think of these things because you don't go these places. It's hard. That's why it's so easy for you to vote no on places you don't go. I have a stimulus package that's ready to hit the forgotten. I thank God for your emotions that you shared on this dais today, Commissioner Proctor. It's nobody's fault. It's a reality we have to deal with. And I appreciate you challenging someone, because other neighborhoods, guess what they did, Commissioner Dozier? They had 62 inmates. They did a GoFundMe fund and paid for them to be vaccinated. I feel your pain. It's only by the grace of God that I'm not still in there, that I'm on the outside, remembering them that are on the inside. And Commissioner Jimbo, thank you for representing your people today. God bless you.
Thank you, Mr. Sims. Mr. County Administrator, I believe you have one other speaker. Is that correct?
We do, Mr. Chairman, thank you. We have one virtual speaker, Ms. Courtney Atkins. Ms. Atkins, I'll just remind you that when you're asked to speak, you'll be added to the meeting and you'll be prompted to unmute your device, and if you choose to activate your video. Once prompted, please state your name and address for the record. And again, keep your comments to 3 minutes. I see you there, and I think we can hear you loud and clear. If we experience any technical difficulties during your call, please bear with us and we'll try to resolve them. Mr. Chairman, Ms. Courtney Atkins.
Thank you. Welcome,
Good
Ms.
afternoon,
Atkins.
Commissioner. Thank you. Good afternoon, Commissioners. I'm Courtney Atkins. My address is 1126 Lee Avenue, Tallahassee, 32303. I want to thank you for your support of Whole Child Leon and just provide you with a brief update about our work today. 17 years ago, Leon County was designated a Whole Child community, and we have appreciated your support that you've provided Whole Child Leon from the beginning. We've grown and developed over time, but we've held fast to our core values, beliefs, and missions. Like Whole Child's founder, Governor Lawton Chiles, we believe the earliest stages of child development are critical in promoting lifelong success. If our children are to reach their full potential, we need a commitment from our entire community. Our goal at Whole Child is to see a community where every young child, no matter what neighborhood they live in, has everything they need to thrive and arrive at kindergarten ready to learn. Despite multiple programs serving children and families, more than 25% of children here in Leon County still arrive at kindergarten without the skills they need to succeed, and 1 in 5 live in poverty without enough food to eat. Poverty, health care, access to pre-K, and social emotional attachment all impact a young child's ability to succeed. We know that single strategy programs aren't effective. Whole Child believes the solution is to work together. Agencies and programs that serve families with young children should not have to compete for the same resources, but should find ways to maximize service delivery so more children are served. And that's where we come in. Whole Child acts as that catalyst for change. We collect and analyze our community's data to identify what needs to be done for our children, and then we do it. We don't replicate programs, we connect them. We don't provide direct services, we convene the right partners to provide needed services, especially those missing from our system of care. Some examples of our work and our initiatives include the publishing of the Status of a Child report, which is a comprehensive data report of indicators related to child well-being. This report is utilized by organizations throughout Leon County, and we look forward to publishing our next report in May. We convene the Summit on Children, an annual community-driven event created to increase public and private business awareness, engagement, and investments in early childhood programs that will drive better outcomes for our children and families, and ultimately the future of Leon County. Whole Child hosts a monthly professional network, community conversation of human service providers across sectors. We provide a forum to hear best practice programs and to identify gaps in our system of care. We facilitate free, twice annual comprehensive screenings for young children and have connected over 1,500 families to care providers. We created the Tallahassee Pediatric Behavioral Health Navigator Program in partnership with the Tallahassee Pediatric Foundation and FSU College of Medicine, where we have connected more than 3,200 children and families to behavioral and mental health services here in Leon County. And next week, we're excited to be piloting it.
Ms. Atkins, I'm sorry,
Yes.
your time's expired, ma'am.
Okay,
Chairman.
thank you.
Thank you very much.
Can we waive that? Can we waive it and let it finish?
Ms. Atkins, thank you very much. Mr. County Administrator, are there any other speakers?
We have no more speakers.
All right, thank you. Commissioner Maddox and then Commissioner Dozier.
Mr. Chair, I'm sorry, that was,
Okay.
Yes.
All right, Commissioner Dozier.
however, on Commissioner Maddox's behalf, I was wondering if we could actually separate the votes for option 1 from votes for option 2 through 6, as we have on other agenda items where we might be conflicted out for one option but not the rest.
Yes, I think that's a good approach.
we need a
That would-
motion?
That would allow Commissioner Maddox to vote on the other items, for sure.
Okay.
I believe the county administrator is going to.
Okay, so I will make a motion for option 2 through 6, and we can come back to CHSP after discussion. Does that sound good?
I'll second that.
Thank you.
All right.
All right, and with that, a couple comments, Mr. Chair.
Great. Okay. Mr. Dozier.
Okay, thank you. Just wanted to make sure we got that in the right posture. Well, I appreciate all the comments that were made today, and it really, I think this is significant. Again, we were talking a little while ago, this has been a year, and from UPHS, Legal Services, OASIS, you all have done so much in the last year. Keep your doors open, as you said, Leslie, while everything has been going on, and people are in greater need than ever. So thank you very much for continuing to provide that incredible service and for the coordinating piece. I think that was really critical. And I want to give a shout out to UPHS for working so closely with our staff and with our providers. Really good connecting point for all of us to come together. So this has been quite the year, and I think we've shown the best of ourselves, which is wonderful. Going forward, I think we're in the right posture with the funding levels. I think CSC, the Children's Service Council, is going to be very interesting to see how that works in the future. And I know it was noted in a couple of our items today that could change some of the dynamics. I'm thinking of Courtney's comments there about Whole Child Leon. So I really am happy with where this item has landed. And there was only one clarification, Mr. Chair. County Administrator and we talked about this during briefing yesterday. I think it was at our last meeting, possibly the meeting before, but we had the presentation from Amanda Wander with Big Bend Continuum of Care, and she suggested that we align our CHSP metrics for those nonprofits that provide services for homelessness or transitional housing with Big Bend Continuum of Care metrics. And one thing we didn't talk about was whether or not the city would join us, because we have one process with CHSP. So, Ms. County Administrator, I promised I would mention it today, and you don't need that in the motion. We're just going to reach out to the city to make sure that we are in the right posture moving into 2022. Correct?
That's correct.
Okay. Thank you for that. And the last thing, Mr. Chair, is just since I had the opportunity, Appalachia Regional Planning Council is on the list. As noted in the item, this is for the Sustainable Community Compact. I hope I got that title correct, close enough. We have been meeting recently, and they are working on that, but they are also developing a resiliency compact that will cover our entire 9-county region. And so I think this is a really exciting time to see their focus on Leon County and Tallahassee, but also I think there'll be some good opportunities to work region-wide on sustainability as we move forward. That's it, Mr. Chair. Thank you.
That's great. Great comments, Commissioner Dozier. Thank you very much. Commissioner Cummings, then Vice Chair Proctor, and Commissioner Welch.
Well, thank you, Mr. Chairman. I'd like to just first of all thank staff for the analysis and synopsis for bringing this particular agenda item. And I also like to commend all the entities that from year to year provide those services to our vulnerable population. I want to specifically commend Ms. Leslie Powell-Boudreaux, who spoke to us tonight. She's the Executive Director of Legal Services of North Florida. And I have firsthand information that they have done a tremendous job this last year with COVID-19, providing direct services to so many individuals, those landlord-tenant issues, individuals who were facing mortgage foreclosures, unemployment, just a myriad of issues that they address with the increase in clients. So I want to commend Legal Services of North Florida for those direct services. But I'd also like to indicate on the record, Mr. Chairperson, that I am on the board of Legal Services of North Florida and have been on the board probably for over 20 years or so. So since this is an agenda item, I get directions from you and from the county attorney as far as my recusal on this particular agenda item.
Yes, Madam County Administrator, Madam County Attorney.
Thank you, Mr. Chair. Commissioner Cummings, you would receive no personal benefit by virtue of the vote. However, if you feel that there would be a perception of a conflict, you would be authorized to recuse yourself on that basis.
Thank you.
Any other questions?
I won't
Commissioner Cummings?
receive any specific benefit, but to avoid the appearance of impropriety, I will probably just recuse my vote.
Okay. All right, Commissioner Cummings, thank you very much. Any other questions or comments?
No, that's all. Mr. Chairman, thank you.
And I just wanted to say, it was really a pleasure working with Legal Services of North Florida. I followed the footsteps of Commissioner Dozier, pardon the pun, and participated in Dancing with the Stars last month, and it was incredible. I mean, the people that were involved in that were just terrific. And Commissioner Cummings, I mean, just being on the board of that great organization, I'm sure is a lot of very fulfilling. And Leslie, great work, you and your entire team, Brian Stewart, Charlotte Waters, and everybody, really terrific. My understanding is that they've tracked down that video of my performance and burned it, so you will not be able to find that anywhere on YouTube, but great job for a great organization.
Mr. Chair, forgive me for the interruption. I have some short videos if anyone wants them, and you did do a fantastic job, and your daughters loved it.
Great, thank you very much.
If I can just comment to members on the dais. Our chairperson made us proud. He did a great job. He didn't have 2 left feet. He did a great job in the competition. So congratulations.
Well, you're very kind. Thank you very much. Really appreciate it. Okay, moving on to Vice Chair Proctor and then Commissioner Welch.
Thank you, Mr. Chairman. Commissioners, I want to be sure that the ask of Commissioner Dozier to our county administrator was that a conversation or meeting with the city, a meeting with the Big Bend Continuum of Care, that there will be an alignment of our matrixing with Big Bend and the city and the county. Is that what county administrator said?
Mr. County Administrator.
I'm sorry, Commissioner, I didn't quite catch that. I think what you were referring to was Commissioner Dozier's request that we align our metrics with Big Bend BOC as well as our CHSP process as we evaluate our progress in those efforts. And I just acknowledge that we would make sure that we facilitate that with the city of Tallahassee.
Okay. Thank you. I want to make sure we were tight and right on that. Commissioners, I just want to say that this amount of money that we spend in human services, what percentage does it, Mr. Administrator, represent for our total budget? Are we at 1% or 2%? Or?
I think we're over 1%, but let me defer to Alan on that.
It's between 1% and 2%. In this information in front of you.
Okay. It has taken us a long time to find ourselves philosophically that it's okay that we would expend at least 1% of the county's budget on human services. And for quite some while, we have not lifted these entities up for the work that they do in filling in the gaps for our community. I think this past year, the value of each of them has rang true. And it's interesting to me that on our previous item, we rather cavalier manner offered to give $833,000 outside beyond the context of the budget of the sheriff. And yet the sheriff walked in and got $833,000 from us, just almost mindlessly. And we never moved the needle on these agencies. We never really up it. We would die first before coming up with $800,000 new dollars to afford these entities, and many of them serving in a way in which would help to limit the sheriff's need of $833,000. I dare say that if we found $800,000 to add to our human services, the sheriff would need $800,000 to add to criminal law enforcement. And we lock these people in year after year, and we can do better. And this is a budgetary consideration. That homeless shelter, I'm sorry, may I ask for 2 minutes, Mr. Chairman?
I'll make the motion. Is there a second? Okay, motion to extend Vice Chair Proctor's time. All those in favor say aye. Aye. All opposed? Okay, motion carries unanimously. Vice Chair Proctor.
Thank you, our colleagues. That homeless shelter went in and incurred a lot of front end debt, and they really gave first class spacing out, privacy. They upgraded people during the pandemic, and we're still willing to be engaged at $100,000 for all that they offer. I just think that if the sheriff could come and get $833,000 just like that, at some point we've got to get a little more engaged to give a higher percentage of our total budget to these organizations that do the work that prevents people from seeing the sheriff and the Tallahassee police and those others. We either put the money invested in the human services, or else the sheriff can just come in and pick up $1 million here, $1 million there as we need it. But over the last year, I think that we have seen the best of the angelic forces of these entities serving nobly, and we dare to not offer them $1 more than we did last year. Something is wrong. And I think that we should look at this recommendation here, but not lock ourselves into a permanent and final status, but to gnaw on this bone a little further to give a more equitable infusion. And then let us not forget that this year for Children's Services, our voters decided to fund $7 million for a plethora of approaches and services to keep them from seeing the sheriff. So I think, Mr. Chairman, what I'm asking is that we not lock ourselves into these numbers as the final. with the $50 million coming down, 57 million, I think the county administrator said, we said earlier that this is an opportunity this year that we want to engage and have a say in some of that money. And if we can in any way make it meaningful to some of these wonderful organizations, I think that we should. Therefore, I ask us to not lock it in. Let's stay open and also think about the flow of COVID dollars coming through to give a little higher lift. Thank you.
Thank you, Vice Chair Proctor. Commissioner Welch.
Thank you, Mr. Chair. You know, I appreciate Commissioner Proctor's commentary and don't necessarily disagree with him. I don't know what kind of budgetary implications that would have, but county administrator can answer that after my comments if he doesn't mind. But I just wanted to say, you know, I'm new to this job, obviously, and so all of these organizations are relatively new to me, and I've had the opportunity to kind of tour some of them and learn about some of them, and I think it's important to note, because I think a lot of people don't really realize that, you know, a lot of these programs are saving the county money. If you look at the analysis, you know, it would be costlier for the county to administer these things. And one of the things that I was able to tour was the Juvenile Assessment Center at Disk Village in the past month or so. And I think, you know, that's talk about keeping people out of the jail, taking our young people to an off-site location to process them when they have encounters with law enforcement is extremely important. And so I think that's just a great example of something that could be expensive that this kind of programming helps offset for the county and potentially save money. So that's all I had to say on that. And then I'll let the administrator talk about Commissioner Proctor's budgetary cap or not cap. Thank you.
Thank you, Commissioner Welch. Mr. County Administrator?
Sure, Mr. Chairman, just a couple of pieces, just if it's helpful to add to the discussion. On this, it should be noted that the board has not decreased CHSP funding over the years. In fact, over the last couple of years, we've increased it. And that is during a period of time where we obviously saw very, very significant revenue reductions. So we've not done that. That's something to be said. We're also in our second year of a biennial budgeting process for the CHSP agencies, which came as a request from the CHSP agencies to provide funding certainty. And in the second year of the process, which again is why we are maintaining or recommending to maintain consistent funding. I think an important point that Commissioner Proctor brought up was that the additional federal dollars. Should you approve the recommendation tonight, while this would lock in, so to speak, the general revenue that the board appropriates to this funding, it would not in any way limit your ability to dedicate additional dollars should they be available and allowable for those purposes with the new federal funding. I just want to make that point there. It would not limit you in any way from doing that in the future. So thank you, Mr. Chair.
Thank you, Mr. County Administrator. And just to springboard off of what Vice Chair Proctor said and the County Administrator, a lot of these agencies, both within the CHSP process as well as the ones listed in option 6, many of them had an increased demand during the pandemic. So I know we've got a very tough fiscal year coming, and we'll find out exactly what those numbers will be in late April. So I know that's coming. I know we're going to be really trying to figure out how to make ends meet next fiscal year. But I think these funding levels, maintaining these at the level that they were last year, is a very good idea. Now, regarding the federal funding, the COVID relief funding that is coming, the fact that we have, under most cases, until the end of 2024 to expend those funds on allowable expenses, I think gives us more. It's not just simply 1 year of non-recurring funds. We do have the ability to, we'll have to look at the details, of course, but be able to maybe spread some of that funding out in very strategic ways. So we'll see what the details provide us when county staff gets back to us on that analysis. But I'm very encouraged by the very glimpse of what I saw NACO present on the COVID relief bill just a couple of days ago. So it looks like the way that the bill is constructed is very helpful for local governments like ours to be creative in how we might be able to use those funds. Okay, with that, I've got the motion made by Commissioner Dozier and seconded by Commissioner Maddox for options 2 and 6 as written in the agenda. All those in favor of the motion, say aye. Aye. All opposed? Okay, the motion carries unanimously. Is that correct? Okay.
Cummings abstained. and-
Oh, I'm sorry, Commissioner Cummings. So the motion is 6-0 with Commissioner Cummings in abstention. All right, is there another speaker? Commissioner Dozier?
Mr. Chair, I was going to make a motion for option 1.
Second.
Thank you. And actually, I had another question on my list, but I think you covered it with, Mr. County Administrator, thank you for going through those details about the last few years.
Great, thank you, Commissioner Dozier, for being mindful of the time. A motion for option 1 as presented, made by Commissioner Dozier, seconded by Vice Chair Proctor. All those in favor say aye. Aye. All opposed?
Mr. Chairman,
Yes.
Abstain.
Motion carries 6-0 with Commissioner Maddox in abstention.
Mr.
Vice Chair
Chairman,
Proctor.
you missed me, but I wanted to register the same sentiment and direction that in option 1, that we likewise, to the extent that there may be COVID surplus dollars coming to us, that those agencies in human services under option 1 would be given the same consideration for our adding a little more volume to helping them in alleviating the challenges they face as well. So I want to make the same argument for both options 2 through 6 as well as option 1. Thank you.
Mr.
So,
Chair,
Vice Chair Proctor, I'm not sure I understood. Is it a comment that you're making?
Yeah, that's a comment. I thought I made a good stance for taking COVID dollars and not locking into this being the fixed amount, but us being open to channeling a little bit more if we can. And I want to make the same exact statement for option 1 that we just also voted on.
Yeah, I think probably we may not need a motion on this. I think there's maybe a general consensus. When the federal funds come down, we need to think very strategically about how we can maximize those dollars to benefit the community, specifically with regard to perhaps these agencies, those within the CHP network, and other ways.
Yes,
Does that
sir.
sound fair, sir?
Yes, sir.
All right, thank you, sir.
I just wanted to clarify something with the County Administrator, Mr. Chair.
Commissioner Dozier.
Just because we've come back to this point a couple of times, and the reason why I didn't include the CARES dollars or any stimulus dollars, this is discretionary funding levels for our typical budget program, or our typical budget process. And anything else we're going to deal with when we have those details. Is that right, Mr. County Administrator?
That's correct.
Okay, so those options aren't off the table. It's just 2 separate votes,
Correct.
2 separate discussions. Okay.
Yeah, thank you, Commissioner Dozier. I've got, Commissioner Cummings.
Yes, Mr. Chairman, just point of clarification, I just want to make sure it was noted that I abstained from both votes.
I'm
No, you
sorry,
gave me
can
for the second one, but not, for the first one, but not the second one.
I'm sorry, it's hard to hear you with the mask. Are you, so the motion on the table is option 1? Is that what you're asking?
No, I just want to make sure you have that I abstained.
She abstained.
Yes, I
for
did.
2
I
through 6,
recognize that.
but she voted for option.
Yes, thank you,
1,
Vice
so-
Chair Proctor. Yes, I did recognize that. Thank you, ma'am. Okay, so the motion on the table is for option 1, made by Commissioner Dozier, seconded by Vice Chair Proctor. All those in favor of the motion as stated, say aye. Aye. All opposed? Okay, the motion carries 5-1 with Commissioner Maddox in abstention.
No.
You raised your hand when I said all those in favor of.
6-0, 1 extension.
Okay, so the final vote is 6-0 with Commissioner Maddox in abstention. Is that
Correct.
correct? Commissioner Cummings? Okay,
Okay. Gotcha.
okay.
Point of order, real quick.
5-0.
So Commissioner Cummings, I believe the perception of a conflict that you voted, that you recused yourself regarding relates to option 6, which was part of the previous vote. Option 1 is to approve the CHSP funding level. So I do not believe you would have a conflict or the perception of a conflict for purposes of that vote.
Okay. Thanks for clarifying that.
So just to clarify, Commissioner Cummings, you would vote in the affirmative for the motion of option 1, correct? Okay. Commissioner Maddox?
Point of clarification. Madam Attorney, if you are a board member of an organization but a non-paid board member, that does not present a conflict, correct?
That is correct, Commissioner Maddox. When Commissioner Cummings asked about that previously, I indicated there would be no financial benefit to her at all. However, she felt there was the perception of a conflict since she served on that board, that she could recuse for the perception of a conflict.
There's more information for myself, but thank you.
So, Madam County Attorney, just to clarify that this is just a matter of discretion of the county commissioner that would vote on the item, correct?
That's correct.
And this is the only time I will ever recite a Florida statute, so I'm going to do it right now. That's section 286.012, correct? All right.
You're very...
Had to use my moment in the sun to say that one time. All right. All right, so the motion has passed 6-0 with Commissioner Maddox and abstention on option 1. Mr. County Administrator, would you please introduce the next item?
Thank you, Mr. Chairman. Commissioners, this item number 18, seeks the board consideration to reallocate funding previously allocated to the Kearney Center. Commissioners, you'll recall that the board recently approved $1 million in CARES funding to the Kearney Center to pay for the match requirement for FEMA grant funding. However, since that time, the president recently issued an executive order which authorized FEMA to reimburse at 100% of the Kearney Center's eligible expenses. Therefore, the Kearney Center no longer requires the CARES funding to support the FEMA grant. However, the Kearney Center has requested that they be allowed to use the $1 million to pay for COVID-related expenses that are not eligible for FEMA reimbursement. Commissioners, the Kearney Center has indicated that the funding will assist in its plans to open and resume operations of the Kearney Center facility. And with that, we're recommending option 1. Mr. Chairman, I have one speaker on this item.
Thank you, Mr. County Administrator. Mr. County Administrator, would you please introduce the speaker?
Stanley Sims.
All right, Mr. Sims, you know the drill. Please state your name and address for the record, please.
Hey, Mr. Chairman, I'm kind of cheating a little bit. I'm cheating a little system. I got to go to another meeting at 5:30. Madam Lawyer, I like that cup. Here's what I really want to tell you, really quick on this. Commissioner Dozier, I had the privilege of going to the meeting in reference to the City Walk situation. And one thing I love about my brother Vince, even though I'm not the most traditional person, he listens to me. And I'm looking to this municipality to take the leadership. It's 2 issues that I've got an issue of concern with. And Vince, I don't know if this is in your privy, but if you can help us, I appreciate it. And that is, we need real clear policies and procedures about dealing with our homeless. And when we talk about housing them, let's not only think about shelters. Let's think about some other ideas like transitional housing and other things of when inmates are coming out of prison and halfway houses. That's what they used to call them, work release. That's what I was working for when I was in prison. And so these are the kind of things. And then the next thing, Mr. Vince, is ain't nothing but white folks on them boards, even the staff. They need to be diversified. All white people. It's hard to really, this is a very sensitive area. And just because I'm pro-black don't mean I'm anti-white. I live out there with them folks. I live right behind Buckley. And they're good white folks. So we have a few we have a little change with, but that's everywhere. You understand what I mean? We gave them blankets, water, food, all that when they just wanted to be a cold night. But when they changed the process and did, the bar, it wasn't about race. And I'm just as black as they come, and I'm out there and my dog black. They don't bother us, so it ain't about race. It was the way it was done. You don't just do it like that over there. That's how y'all do it in black communities. You just drop something on it. You can't just drop something in a white community. It ain't gonna work out like that. So please, Mr. Vince, talk to the city and help us out with that. I like that cup. I
Thank you very much, Mr. Sims. Okay, we have Commissioner Cummings in the queue to speak. Commissioner Cummings.
Thank you, Mr. Chairman. Before I make a motion on this item, I'd just like to make a couple of comments, Mr. Chairman. I want to recognize the hard work of the people out at the Kearney Center, how they have addressed the needs of the homeless. It's a vulnerable population and they do need special attention. And the Kearney Center has stepped up to the plate over and over again. I also want to thank the county administrator and his staff for just bringing us detailed information on these items month after month. But I believe we also have a vulnerable population, and that's our communities of color as it relates to COVID-19, the lack of being vaccinated against this deadly virus. And I believe that's a pressing issue. I believe it's an immediate issue that we need to address. Being a person of color, of course, I've experienced firsthand the pandemic with friends and family, and certainly in the community of color. So Ms. Blackburn told us tonight that while we have more vaccines that are available, we still have resistance from communities of color. And it's no question that the data shows that there's a disproportionate effect on members of communities of color as far as hospitalizations, as far as the death rate, and clearly lack of being vaccinated. So I understand the federal government, and we are all looking at this legislation that's being proposed right now, but I believe that we here at the county need to address and do a little more about this vulnerable population. So therefore, I'd like to move to amend option 1 as presented by the county, as proposed by the county. And I move to provide $500,000 to the Kearney Center and to allot $500,000 to address the immediate needs of vaccine hesitancy in the communities of color. We believe it's urgent. I believe as part of our motion, I'd like the board to authorize the county administrator to convene meetings with community partners and others and implement immediate strategy to address this issue. And then I'd also recommend, as part of my motion, that the county administrator bring a report back to this body on the progress that's being made. I believe it's urgent, just as homelessness is urgent. It's critical because we have people that are dying and suffering in our communities of color, Mr. Chairman.
Thank you, Commissioner Cummings. The motion has been made and seconded by Commissioner Maddox. Thank you, Commissioner Cummings. Are your comments completed?
I'm sorry, yes.
Okay,
Yes, Mr. Chairman.
Thank you very much. I've got in the queue, I've got Commissioner Dozier and then Commissioner Maddox.
Thank you, Mr. Chair. Before I share a couple comments, I just wanted a little bit of clarification. Commissioner Cummings, your motion is $500,000 for the Kearney Center and $500,000, it wasn't specified, but to meet the other needs, or specified for an organization? Is that what I heard?
Yes, if we would take half of the million and direct the county administrator to deal with a group effort to determine how best to utilize that funding to assist the minority communities as far as vaccination, resistance to vaccination. There are individuals that don't have transportation. There are individuals that just lack knowledge about the needs and the importance of vaccination. So part of my motion is directed to the county administrator. We would direct the county administrator to come back with a report to this body on the progress.
Thank you, ma'am. It is a critical need. I could get there, but I do have a question now, Mr. Chair, if I can go to my comments for the county administrator. I don't have the details in front of you. It was my memory that the December stimulus funding, that we had allocated a good bit to, I know there was contact tracers and the health department to staff up. And then we had allocated money to I want to say marketing, that's not the right term, but the community outreach. Could you remind us if we have provided that funding and where we stand with that at this time?
Mr. Chairman, Commissioner Dozier, yes, you're correct. Happy to provide that. And to Commissioner Cummings, I talked to Commissioner Cummings about her proposal and her thoughts on that tonight. And certainly, this is appropriate and certainly within the board's discretion tonight to reallocate these funds. But specifically to Commissioner Dozier's question, yes, I could give you a thorough accounting of all the dollars up to the 70 million plus that now working on that we've expended, much of which has gone directly to communities of color to address needs. However, our COVID dollars under the existing dollars are pretty much expended at this point. And as we await the new allocation to come down the pike, while we have a lot of issues addressed or in the process of being addressed, in terms of targeted communication being one of them, where the board has allocated just at a couple meetings back, $75,000 specifically just for targeted media buys, again, in addition to all the other work. But a piece that the community has been working on is this piece that you've heard a lot about tonight, which is the grassroots, boots on the ground, knocking on doors, getting in the community, and in some cases perhaps providing transportation and providing greater access with individuals, community of color, not only on vaccine hesitancy, but on vaccine access and facilitating that access. That's a piece that's a missing piece, if you will, right now in terms of what our dollars have gone to thus far. And certainly based on Commissioner Cummings' motion, should it pass, I would convene stakeholders. We've already been convened and we've already been talking and working on a lot of different things and a lot of different programs, but this would certainly provide a bridge, yet another bridge from to the next round of funding, but specifically targeted to facilitate, again, for communities of color, the access to the vaccine and to address, continue to address vaccine hesitancy, utilizing things like we've heard tonight, trusted voices, trusted places, that whole concept. It would provide funding for us to do just that.
And, okay, thank you for that. And the gap in the funding, that makes that kind of changes the dynamics here because we anticipate more funding coming through the next stimulus, but I think you said earlier we're waiting 60 days for the first half of that funding. Is that correct?
That's 60 days, yes, upon passage of the bill, yes.
Okay. So I see two critical public health needs, reopening the Kearney Center and addressing some of the funding. I think they spent $1.1 million on some of the issues this year. I will just leave it general there, cleaning, other things like that to house people outside of the Kearney Center. It's my understanding, I think they're going to be reopening the Kearney Center around April. Is that correct? To the best of our knowledge?
That, to the best of our knowledge, yes.
So we've been talking a lot about homelessness, and getting people back into the Kearney Center is not just a good thing for a safe and secure and healthy environment, but also that's the place where we have the medical services and all the wraparound services. So that has been a critical need that I think we've all recognized, and we've all recognized, as you said, the vaccines. What I'm wondering, I mean, just to make this change in the middle of the meeting, I can get there with you, Commissioner Cummings, because this is what we're facing right now while we wait for the remainder to come in. My concern, Vince, is that, Mr. County Administrator, is that we may still need to provide funding for the Kearney Center to make them whole because FEMA's not going to reimburse the other $500,000. Is that correct?
Mr. Chairman and Commissioner, yes, that's correct. We fully anticipate with the new round of funding that we would be addressing the continued needs of the homeless population and the Kearney Center specifically. Within the $350 billion that's coming to the locals and the state, perhaps, but there's also categorical funding in $1.9 trillion that includes about $1 billion specifically outside our funding, in addition to our funding, that we expect to be funneled through the continuum of care structure with about $1 billion, which would be made available in the new round of funding as well.
Okay, so all of this is good. These are all related needs. Funding that may come through continuum of care, that if that goes through their funding model, that's going to go to transitional housing, to other permanent supportive housing, those types of things. I think Commissioner Proctor, several of us have mentioned that as a need today. So I wouldn't necessarily want to touch funding that was dedicated to shelter support or transitional housing. This is kind of making them whole because of the money they spent for COVID response in the last year so that they can continue to provide services. That's what the $1 million was for. It was to address that budget impact from COVID. Is that?
That is what the initial $1 million was for, in terms of a match requirement for them to draw down many more millions of dollars in FEMA funding. And again, with this change, what their request is to utilize all, or with the current motion on the table, some of this funding for dollars or for expenses that are not FEMA reimbursable.
I'm just wondering if we can earmark not the continuum of care dollars, but earmark, and this is tricky because we don't have the details from that stimulus funding yet, but Commissioner Cummings, if I can get there on the motion for sure, and I appreciate the creativity in looking at some of these dollars for the vaccines to address that particular issue. But I would like for us to earmark $500,000.
Commissioner Dozier, your time has concluded.
Is there a motion to extend Commissioner Dozier's
Was it
time?
all?
All those in favor say aye. Wait, who made the motion? Actually, I can't make the motion as chair. Who made the motion to extend Commissioner?
I'll make.
Okay, Commissioner Dozier's motion, seconded by Commissioner Maddox to extend her time. All those in favor say aye. Aye. All opposed? Passes unanimously. Commissioner Dozier.
Whenever we want to get rid of that rule, I will entertain that motion. So going back to this, could we include in your motion a consideration of $500,000 when that new stimulus money comes in to make the Kearney Center whole, to ensure they can continue to provide their services, but using that half of the money right now for this immediate need?
Mr. Chairman, I would defer to the county administrator to see if we would have that flexibility with
Thank you,
the
ma'am. Mr.
allocation.
County. Thank you, ma'am. Mr. County Administrator.
Thank you, Mr. Chairman and Commissioners. The short answer is we don't know exactly yet what will be allowable. We're going through the process now. I think it's probably a very fair assumption that we would have the ability to do that. We just don't know for sure if that funding will be allowable within the dollars that we get for those purposes. I believe it would be. And as for the additional categorical funding that's coming down to COC, I believe there's some discussion in the legislation that they may be required to do certain things in addition to what their core services are. They may actually have to re-grant funds to homeless shelters and others with this categorical funding. So we're in the process of analyzing all that now.
So perhaps the posture is to earmark a discussion, that $500,000 for the Kearney Center be part of our first discussion once we get the details of the new stimulus. That way we're not committed to the $500,000, but we have it in place, so it's at the top of our list for discussion.
Mr. County Administrator.
Would that be?
I don't have a problem, Mr. Chairman, with that being a provision, that it would be top of the list for discussion. I don't have a problem if that's part of the amendment to the motion.
Yeah, Commissioner Cummings, do you mean that?
Commissioner Cummings said she didn't have a problem trying to understand what Commissioner Dozier was asking for, though.
What?
No, but just 1 second, please. So Commissioner Dozier, Commissioner Cummings, so are you saying you would want a provision to have a discussion about it before, at the next meeting, before we vote on it?
It's my
You're not saying-
understanding the discussion would be after the allocation.
Okay,
That was my
Okay.
understanding, after the allocation was received.
all right. Commissioner Maddox, does that provide some clarification for you?
No, it doesn't.
Chairman, I may be able to help.
Mr. County Administrator.
I think that discussion would come back during the budget workshops when we bring the package to you on the new funding. And if that's the board's direction, certainly we would include that as part of that initial direction. Again, if that's the board's direction to include that as a specific budget discussion item related to the Kearney Center and $500,000, if that's the board's direction.
On point.
Mr. Ch-
I'm just trying to understand. So what you're asking for is a budget discussion item to come back for $500,000 to come out of our budget?
No, I am profoundly concerned that we're making a decision. The Kearney Center was due to get 75% of this $1 million. They had the match. I think there was something in there. Ms. County Administrator, correct me if I'm wrong. And now we're taking it down to 50%. We need the Kearney Center to be open. I mean, this is a critical issue that I know we all care about, but Commissioner Cummings has brought up another creative idea and critical issue right now. So I'm just trying to plant that flag when we get the new stimulus dollars and an understanding of what we can do with those dollars, that $500,000 to make Kearney Center whole, which is what is in this agenda item, or to come back here, that we have that conversation at that time.
Okay.
I don't know what program it comes out of, and Ms. County Administrator, what you just said about the COC needing to re-grant the dollars, they re-grant almost all dollars. They get, that's their role, is to do a grant application process with Big Bend Continuum of Care, Kearney Center, CCYS, and the other providers. So that's the money, we need those dollars to get more transitional housing and others. This is reimbursement for expenses in the last year. And I'm really concerned about what it's going to do to the Kearney Center's ability to reopen right now. I mean, last question, do we know what this might do to the Kearney Center?
Mr. Dozier, you retain the floor, but let me ask the County Administrator to provide some clarification. Mr. County Administrator.
Sure. If the board was to reallocate all of these dollars, just again, from the Kearney Center to whatever other effort the board wanted to do, I want to make it clear that the Kearney Center would not be receiving any less funding than they were given, than the board had allocated in their previous direction. The Kearney Center has been given now the ability to get reimbursed 100% of their eligible expenses by the federal government. 100%. What we were doing with the previous $1 million is we were providing match funding for them. That match is no longer necessary. So by taking this action, you're not taking away dollars from the Kearney Center. It's just that they were requesting, could they retain it for other purposes? Understanding that they have other expenses, and we acknowledge that. But again, I just wanted to make that point clear.
And on point, Mr. County Administrator, so in other words, you could say that the motion that Commissioner Cummings has offered does not change the fiscal financial impact of the Kearney Center because the $1 million is now 100% reimbursable by the feds, whereas before we heard the announcement from President Biden, we had to offer that match in order for them to get the 50%, correct? Okay. So, okay. Commissioner Dozier, you still have the floor.
Mr. Chair, I mean, I think this is a really, really tough decision. I mean, we don't necessarily make decisions like this with $500,000 without having more details. And so I'm really struggling with this because you have pointed out, as I said before, Commissioner Cummings, a critical need right now. But for the last two commission meetings, we've talked about homelessness. This has been a critical need. And with respect, Mr. County Administrator, you know, we're not necessarily taking money from them because they had the match, but they did believe that they were going to get $750,000 with that match, or something more than $500,000 for the last month or two.
Mr. County.
I'm sorry, I just want to make sure I understand. They believed that we were going to help them get a match for federal dollars, which they no longer need.
The match they don't need.
Yes.
They no longer need the match.
They no longer need the match.
Federal dollars.
Yes.
But it has been the Kearney Center understanding up until the last 15 minutes that they were going to receive an allocation from Leon County. This item was to adjust what we had previously decided to provide them.
They knew that there would be a request here that the board could reallocate that $1 million away from again, the match requirement and to what they'd like to use the dollars for now. They do understand that, but that's all I could speak to.
And there's no provision for us to make this decision in 2 weeks at our workshop. I know I'm over, but this is a challenging time. That's my last question. Can we make this decision in 2 weeks at our workshop or adjust it at that time? Because the task force is still doing their planning work. We don't know how this will impact the Carney Center.
That, Mr. Chairman, I'm sorry, it really is a matter for the board to decide relative to the immediacy of the request. We would anticipate that should the board allocate the $500,000 that Commissioner Cummings has made the motion on, that we would be spending those dollars in days, not weeks.
Okay.
Mr. Dozier? Thank you, Commissioner Dozier. Let me jump in here for a second. I think this is a very promising idea, Commissioner Cummings. And we're having to juggle between two very, very important issues here. One is the homelessness issue, helping the people that are struggling with homelessness find affordable housing and caring for them in the process as they transition into housing. The other one I see is even more important, even more urgent because it deals with life and death. And yes, we were number one a couple weeks ago. Leon County was number one in the percent of seniors that had been vaccinated. And right now we're at 74%. But the fact that we have African Americans that are 65 or over, only vaccinated at 40%, that just means that discrepancy is incredibly vast. That means 40% of African Americans that are 65 or over, but yet almost every other person in the county has been vaccinated that's 65 or over. In my mind, that is a life or death situation, and we need that money now. I think the $500,000 is something that I think could be very strategically spent. Your motion, Commissioner Cummings, basically gives that authority to the county administrator and his staff to use their judgment on how to allocate those dollars to have the most effect, and then report back to us once that money has been allocated. As Vice Chair Proctor and Commissioner Jackson have said earlier tonight, this is a very, very severe issue that we need to correct. And so I, for one, am going to proudly support your motion. I hope the rest of the board will do so as well. Commissioner Jackson, you're up next, sir.
Hey, I promise I'll try to be brief. Commissioner Maddox, you're still quick because you beat me to the second. So although you can outrun me in a foot race, I think you also beat me to the second on her motion. So thank you. Commissioner Cummings, very ingenious and creative and outside the box. I would compare it and make an analogy that you're in an emergency room and you walk out into the waiting room and you have a couple of people in the waiting room to be provided medical services. One person has ice on their knee and the other person has a tourniquet around their neck and is bleeding. If we delay 2 weeks, then we're talking about time when lives would be sacrificed. And I'm very comfortable with the motion. I will support it. I think that every medical doctor that would walk into that emergency room would say, you can come back for a x-ray on Monday at TOC, but we can take care of what you've got going on. And the person that is bleeding profusely from the neck would be provided immediate care. Thank you.
Thank you, Commissioner Jackson. I've got Commissioner Welch, Vice Chair Proctor, and then Commissioner Maddox.
Thank you, Mr. Chair. So my understanding, Mr. County Administrator, is the Carney Center we recognize as important, has to reopen ASAP, but we are fairly safe in assuming that we're going to get a pretty substantial amount of money categorically aimed at those type of issues in the next round of CARES funding, assuming it passes at some point. So I think this is a great idea. I can support this motion 100% because as we have talked about at length, we have a population that is hesitant to get vaccines. We have also acknowledged tonight that vaccinations are going to be the quickest way that we can take off these masks and live a normal life. And so I think this is a smart reallocation of money. It's a reallocation of money that is no longer needed right now. I think it's smart. I think it gives the county administrator the ability to fill that gap efficiently and quickly for those communities that are hesitant. I'll be supporting it. And I thank you for being creative about coming up with that. I think it's a good policy, and I'll be supporting the motion. Thank you.
Thank you, Commissioner Welch. Vice Chair Proctor, and then Commissioner Maddox.
Thank you, Mr. Chairman. Commissioner Cummings, that was no rookie move. That's all I want to say. Thank you, sir.
Vice Chair Proctor, you finished, sir? Are finished with the comments?
Yeah, I was telling Commissioner Cummings that her motion is not a rookie's move
gotcha.
at all.
I thought you were talking about Commissioner Maddox's fund. Thank you, Vice Chair Proctor. Vice Chair Proctor, thank you very much. Commissioner Maddox, sir.
Commissioner Powers, is the theme music for what you was trying to say there. I wanted to say that I think that Commissioner Cummings, that was amazing, the thought processes that you have there with the direction that you're moving in. But I need more clarification from the county administrator. So from the questions that you were answering for Commissioner Dozier, basically these dollars are no longer, I won't say they're no longer needed, but the intended purpose from the beginning that they were used for is no longer the purpose that they would be used for in the matching piece to bring those dollars down from the federal government. Is that correct in saying that, Mr. Administrator?
Sorry, Mr. Chairman. Commissioner Maddox, could you repeat that question?
Yes, just the $1 million that you said that the Kearney Center no longer needs that match, correct?
That's correct.
Okay. To be quite frank with you, with the disparity and the emergency that we have in the disparity, I would have been fine with allocating the whole $1 million there, but I understand the balance that you want to give to the fact that homelessness is something that we have to pay attention to right now too. So I mean, I'm fine with the $500,000, but I don't think we should sit here idle and think that just a $500,000 that we're allocating towards just as much as we're looking at, that discussion item of $500,000 when the money comes down for homelessness. I don't think just $500,000 for the piece that we're talking about with the disparity and the outreach is enough either. So I'll be prepared not to just have a conversation around that. The adding $500,000 for Kearney on the homeless piece, I would say that we dig deeper on trying to find more money on the outreach piece too, until we see those numbers start to increase. So I just wanted to say I think it's a heck of a move, Commissioner Cummings. Thank you for your thoughtfulness on it and your leadership on it. And quite frankly, if you would have said $1 million, I would have been able to go with that and look at maybe how we could help the Kearney Center when those additional dollars come in. Because if you look at it, quite frankly, I'm not going to say they don't need the money right now, but if you look at the most urgency in using those $1 million, I would say it's for the outreach piece, knowing that the Kearney Center is going to get, let me ask, Mr. Administrator, so that the Kearney Center will be made whole by the dollars that come down from the federal government that this match would have gone towards, correct?
The Kearney Center is now eligible to receive 100% of FEMA reimbursement for their eligible expenses, and I think it's fair to say that this was money that they did not anticipate having, and that this is money that they did not anticipate being reimbursed to them prior to the president making this change in the reimbursement.
Thank you, Mr. Administrator. I won't interject your opinion. I'll make the statement for you in that I would say the $1 million is better spent right now on the outreach piece, the whole piece of it, given the fact of if we wanted to reach out to FEMA or the federal government and find another $1 million right here today, we couldn't do it. Nobody else is going to give us $1 million. We got $1 million in hand right now that we can use any way we want to. So why not use on the outreach piece? I mean, you can call me greedy, but I think it's the highest and best use of those dollars and the best and the most need that we have for those dollars right now. And knowing of such that the Kearney Center is going to get that money from FEMA at some point. So But whereas we won't be able to find another $1 million like this for outreach. Thank you, Mr. Chair.
Thank you, Commissioner Maddox. Really good points, Commissioner Maddox. Just thinking this through, I'm thinking off the top of my head. I mean, one thing, Commissioner Cummings, we may want to just think about is your motion was for 500,000. One thing we could do is springboarding off of Commissioner Maddox's idea, hold $1 million, allocate maybe the first initial 500,000 for the county staff to figure out strategically how to do the outreach for vaccinations in targeted vulnerable areas. But then if grant the county staff the authority to actually use that into that second part of the 500,000 is the second 500,000 if they deem that they need those funds in order to do the full outreach. So in other words, you're holding $1 million and then giving county staff the ability, we're granting them the authority to strategically figure out what kind of funds are needed for that type of outreach and then spending up to $1 million. They need to report back to us if they wish. Now, if they decide that maybe 500,000 or 600,000 is the amount that would be enough, then we can come back in April with the remaining money of that $1 million that has not been spent, and then perhaps discuss about to provide that to the Kearney Center. It's just something to think about. I'm totally fine with the motion you have on the floor, ma'am, but it's just something to think about if you would be interested in entertaining that type of. If you're interested in considering that friendly amendment, I would offer that. And Mr. County Administrator, do you have any comments on that?
Mr. Chairman and Commissioners, obviously, this is your discretion. I think with the motion that's before you, I think is a good one. I would also and I know we're all trying to balance these things, and I know this commission is trying to balance these things. I should note that the Kearney Center, again, these dollars, even if it's this $500,000, is just going to help them reopen quicker. As well. And so, and I know that they're working very hard toward that as well. Plus, we think the $500,000 allocated for this purpose gives us time to get to the second round of federal funding, where we may be coming back to you with additional recommendations concerning both of these, homelessness and vaccine hesitancy in the community, in the Black community.
Thank you, Mr. County Administrator. Commissioner Cummings?
Oh, yes, Mr. Chairman, thank you. In considering this motion, I want us to be sensitive to the vulnerable populations here in Leon County. My motion was clearly concerned about the Kearney Center, the services they provide to the homeless, and on the other hand, showing concern for the dire straits that we are witnessing right now in the communities of color that are not only significant and important, but we are talking about individuals that are dying. They are expiring because of COVID-19. So I understand and I appreciate your point, but I believe that my motion shows a clear concern, and it establishes a balance between the vulnerable populations that need those services right now. There's communities of color, and of course our homeless, and the Kearney Center that has done a tremendous job over the years and done a tremendous job now in addressing the needs of the homeless. So I just want to be sensitive to all citizens in that respect.
Thank you, Commissioner Cummings. I think that makes good sense. Seeing no other speakers in the queue, we'll move on to the vote. The motion made by Commissioner Cummings, seconded by Commissioner Maddox, which was option one, but changing the amount to $500,000 to go to the Kearney Center with another $500,000 to be granting the county administrator with the authority to put together a plan, spending that on vaccine outreach to vulnerable populations. Is that correctly stated, ma'am? Okay. Commissioner Dozier, please be brief.
I think so.
No, I'm sorry. I thought we were also including just the discussion of 500,000 when we have the new stimulus come back. So that was part of the motion. Was that right?
Have the discussion, absolutely.
But
Thank you, ma'am.
Just to clarify, the allocation, we're voting on the allocation right now, and then we'll have the discussion after the fact at the April workshop. Is that correct?
Once the federal funding comes down, it was my
Okay,
understanding.
okay.
I believe that was a parameter.
Okay, just want to clarify.
That was it. Once we have the federal funding and we get that analysis, that 500,000 to replace this 500,000, not any other funding, would be part of that discussion.
Okay, understood,
Discussion.
understood. No, perfect, perfect, great, thank you. Vice Chair Proctor, please be brief.
Yes, sir. I'd like to suggest that, and I hate to call names, but I think that Dr. Temple Robinson, her name came up by the county health director. She's been involved in everything from the beginning of testing, shot giving. She works in that population, and I just hope and would encourage that she is a part of. And just like Ms. Blackburn is constrained to rule-bound, there are areas in which Dr. Robinson, if FQHC probably is rule-bound, but this piece of money is a piece of money that can be acted outside of those restrictive, constrictive rules. And I think that the imagination, based upon observation, nobody in the community has been frontline down in the trenches like Temple Robinson, and I would strongly, Commissioner Cummings, hope that she could be a part of the strategies that events would include.
And Mr. Chairman, if I can also mention, in addition to that, and I agree with Commissioner Proctor, but also the Neighborhood Health Center as well, with Ms. Janae Freeman, who is the CFO of that entity. They have done a tremendous job in vaccinating our community as well, and as well as, bringing in the faith-based community. And I think the county administrator is abreast of those individuals that are trying to make a difference as far as this vaccine is concerned in our communities.
Great, thanks to both of you, those are good points. All in favor of the motion as stated, say aye. Aye. All opposed? Okay, the motion passes unanimously. Thank you very much. Mr. County Administrator, please introduce the next item.
Thank you, Mr. Chairman, Commissioners. This item seeks the board consideration of a new contract with Marpan Recycling to continue the county's single-stream recycling program. You will recall back at your November 17th meeting, the board accepted the final report and recommendations of our study conducted by SCS engineers. That study concluded or included.
Mr. Chairman, I move staff recommendation, option one.
Motion's been made by Vice Chair Proctor, seconded by Commissioner Maddox. I thank you very much, sirs.
No speakers.
No speakers, sir? All right. Did you say no speakers?
No speakers.
Okay. Commissioner Dozier, did you speak?
I was getting out the queue, Mr. Chair, but our staff has done a tremendous job, as has Marpan, to bring this in for a landing. Thank you all.
Great, thank you, Commissioner Dozier. Okay, a motion for staff recommendation made by Proctor and seconded by Maddox. All those in favor of the motion as stated, say aye. Aye. All opposed? Motion passes unanimously. Thank you. Mr. County Administrator, please introduce the next item.
Thank you, Mr. Chairman. This next item is a funding request from Children's Home Society. That you heard this at your last meeting on behalf of Sable Palm Elementary, the Community Partner School. A request in the amount of $8,000. Should the board wish to approve this request, the option is provided here for you to do this out of contingency. Contingency is available for that purpose, and we're seeking your direction on this item. We have no speakers.
Who was the commissioner champion this matter? Okay, Commissioner Dozier.
Commissioner Dozier, you've been nominated to speak.
Well, thank you for that, Mr. Chair, Commissioner Proctor, or Mr. Vice Chair, and I will say I am really thrilled I had a co-champion on this, Commissioner Cummings. Thank you for seconding the motion at the last meeting. We heard the presentation on community partnership schools at the last meeting. Frankly, I think $8,000, given how much support the community partnership school at Sable Palm is getting from a whole host of different groups in our community. This is a big return on a small investment for two AmeriCorps staff members to work with them for the next year. And I do appreciate that, Ms. County Administrator, you all noted that the, CPS could possibly qualify for Children's Service Council dollars in the future. There will be more opportunities for children's programs in the future. But the school is doing an incredible job and in an area of our community that we are all very focused on. And I would be very, very happy to make a motion for option 1.
Second.
Thank you.
Motion has been made for option 1 by Commissioner Dozier, seconded by, we'll go with Commissioner Maddox this time. It was simultaneously. All those in favor of the motion, say aye. Aye. All opposed? Okay, motion carries unanimously. Please introduce the next item, Mr. County Administrator.
Thank you, Mr. Chairman. Commissioners, item number 21 seeks the board approval of a 5-year maintenance agreement on our phone system with Avaya Federal Solutions Incorporated. This has been budgeted and anticipated. We have no speakers on this item. We're recommending option 1.
Move option 1, Mr. Chairman.
Vice Chair Proctor has made the motion for option 1, seconded by Commissioner Welch. All those in favor of the motion, say aye. Aye. All opposed? Motion passes unanimously. Next item, please.
Thank you, Mr. Chairman. This item seeks a full board appointment to the Affordable Housing Advisory Committee, and it also provides for you a status report on collaboration between the county and city's affordable housing groups. We are recommending the appointment of one citizen, Oral Payne, and to accept the report that would be options 1 and 2. We have no speakers on these items.
So move, Mr. Chairman.
Second that. Motion's been made by Commissioner or Vice Chair Proctor. Commissioner Maddox, if you don't mind, I'll second that one too. All in favor of the motion as stated? What's that?
Oh, thank you. Real quick, just as your appointee to the board, Oral actually came to our last meeting, spoke very eloquently on his experience. I was very impressed with him as a man. He's going to be a great addition to the board. You'll be happy to know that, man, your affordable housing advisory committee is really burning it up, man. There's a lot of good conversation coming out of there, and you'll probably see some things coming from us, coming from that group here pretty soon. One of the conversations was around creating a comprehensiveness between the city and the county's approach to affordable housing, looking at specifically where we're spending those dollars, zip code wise, and how we're affecting those areas that are in the biggest need, trying to make sure we're concentrating those dollars in those areas. So thank you so much for the appointment. I'm proud to be there, but we are doing a lot of good work there, and I think you'll be proud of you're going to be proud of what comes back from that committee. Thank you, Mr. Chair.
That's great, Commissioner Maddox. Thank you very much. Commissioner Dozier.
Thank you, Mr. Chair. Well, everybody was rushing to make a motion, and I'm happy to support the motion on the table. I had 2 other related issues I thought I'd bring up with this item, and I do appreciate the analysis or the information on the committees. Commissioner Maddox, your service there and long-time commitment and leadership on this issue. So one of the things you just mentioned that the committees want to find more, if I heard you right, a comprehensive plan to kind of coordinate efforts with the city. I got a call last week and someone filled me in a little bit about a contract Escambia County had with Florida Housing Coalition to do a study of their housing programs within the county and to look for any gaps or any opportunities. I mentioned this to County Administrator, and if I'm not mistaken, Mr. County Administrator, you thought that you may be able to bring some information back on this study for our workshop on March 23rd. Is that right?
That's correct. We'd be happy to do so.
If maker of the motion, I think we just learn a little bit more, and it may align perfectly with what the committees would like to do.
No, I think so. And along with that, if we could also have a conversation, I don't know how much you guys, because they actually went through it with us, are exposed to how many different programs there are within that committee and how many are unfunded versus what's funded. Man, it's amazing. So if we could, I think that's a great idea to do that. But also if we could have the board have some kind of overview of those programs that I'm talking about and the ones that are funded and aren't funded. Thank you, Mr. Chair. Yeah, I'll accept the amendment, though. Thank you.
Thank you. And Mr. Chair, I appreciate that, Commissioner Maddox. 2 related issues. One, I just want to learn about a little bit more. It could come up in our workshop. I'm sure you could let us know about this, but we could save the conversation if you'd like. The local government area of opportunity tax credits. For the last 2 years, it's my understanding, our Housing Finance Authority has supported the city's application to housing for purpose-built communities in Orange Avenue. I don't know if that application is going forward for a third time, but it has been suggested by 2 different people now that perhaps we endorse 2 different programs for our community just to increase our chances. I don't know if that would be detrimental. I can understand wanting to have, all of our focus on one good project, or if that's an opportunity to increase our chances because it's so competitive. I just wanted to understand a little bit more of that, and we can bring that back in the workshop as well. Would that be acceptable?
That is acceptable. I think what you're going to find, though, is they do like for you to concentrate because the lottery is so big, but I think it's a good conversation for us to have to inform the commission about, so I will accept that as well.
I appreciate that, and I don't have a stake on one side or the other, Commissioner Maddox, but I've heard about this from 2 different people, so I thought it would help, so thank you. And the very last thing, Mr. Chair, rounding this out, a few of our city commission colleagues have brought up the idea of having a joint workshop. I think some have focused more on homelessness and transitional housing, some on housing in general. For those of us who were here several years ago, I think it may be referenced in this item, but we had one joint workshop, to my memory, it's the only joint workshop that we've had with the city on a dedicated subject like this. And it produced the committees that Commissioner Maddox is serving on for us and the land trust. A lot of good product came out of that joint workshop. So I'm not sure where the city is, but I thought if this is under the discussion there, I think it would be a great opportunity for the 2 boards to meet together. Maybe it's after those committees work, I'm not sure, but so I don't know if we want to have that as part of the motion, but I thought it would be good to acknowledge, if we were so willing to have a joint workshop, that we were willing if the city wanted to move forward with us.
On point, Commissioner Dozier, I mean, with the COVID relief funds that both the county's getting and the city's getting federal funds as well, there may be opportunities, given the eligibility for the use of the funds, to actually combine our efforts on homelessness and affordable housing, so in that area. So
It may be that the committees can work on this and get a coordinated plan. And if you'll remember, we passed unanimously a motion on January 25th to have a coordinated plan for homelessness. And county administrator says that planning staff is working on that. So I know Mr. Sims mentioned this earlier. We've been leading on this for a couple months now, and I'm really excited and proud of this board for doing that. So I don't know if we need a motion. If the city would like to tee this up, a joint workshop, I think it would be great. If you all would like to do it, that'd be great, but we can let the motion go forward as is. Thank you.
thank you, Commissioner Dozier. Got Vice Chair Proctor, and then we'll move to a vote. Vice Chair Proctor.
Thank you, Mr. Chairman. I think Commissioner Dozier strikes a good point. We have met with the city as the blueprint. We have to meet with them, comprehensive planning. But Vince, how long ago have we met as the Board of County Commissioners and the City Commission intention as those particular bodies? It has been a while. And I think that given the sometimes the overlap of the issues that we've had, we ought to have a workshop, which we've not done in, since Moses was actually a little boy. It's been a while. So I think that it's timely, but I think that the limits to one topic, we ought to add, make a morning of it and add more than that one topic what I'm saying is let's not constrain ourselves to that singular topic, but I think it's a great idea.
Thank you, Vice Chair Proctor. Next, we have Commissioner Cummings.
Thank you, Mr. Chairman. I just need a clarification on the meeting with the city that's being proposed, and I guess following Commissioner Proctor. My question was, what areas would we be addressing, would be addressed by the Joint Commission? Would that be framed here, or do we just here vote to have a joint meeting and then the issues framed later? I guess I need a little bit more.
As far as the order of business, I mean, the
Meeting
motion
about-
on the floor does not include the potential workshop with the city commission. The motion on the floor is basically for staff recommendation with two amendments by Commissioner Dozier that
I'm
are not
sorry.
related to the workshop, the joint workshop.
The motion on the floor is what? I'm sorry. The workshop and what else?
The workshop, Commissioner Maddox did not accept that as a friendly amendment to include the joint workshop as part of this motion. So the motion on the floor is for staff recommendation on item 22 with two amendments by Commissioner Dozier that are not related to the joint workshop. Okay. Any other comments about the motion on the floor? Okay. All those in favor of the motion as stated with the two amendments by Commissioner Dozier, say aye. Aye. All opposed? Motion carries unanimously. And then Commissioner Maddox.
Thank you, Mr. Chair. Commissioner Dozier, the reason I did not accept it was because I actually agree more with Commissioner Proctor, but I actually want to make it a little broader if we could. And I don't, Commissioner Proctor, you've been here the longest. Have we ever had a meeting with all of the governing boards, city, county, and school board, to have a conversation around what each other is doing and joint things we can work on together? And within that, we can have, if you want to bring about the conversation of homelessness to the table, if the school board wants to be involved, they can. I mean, from an educational standpoint, if they don't, then they don't. But just everybody bringing their issues to the table. We sit down and talk about it as electeds with our staffs there, and come out of there with some kind of thought process on the things that we're working on together, and an understanding of what each one is working on. 'Cause what we have is you got the city and county usually on the same page with things, right? But we oftentimes leave the school board on an island. But when you think about when we're making comprehensive plan zoning changes and stuff like that, the school board, I mean, depending on what we're changing our area to, is going to be affected by it. So what do you think about the idea of all three governing bodies sitting together? This would be the first one, if we ever had one before, just having a conversation around our issues and talking things out. Just one big workshop with us all is kind of what I'm thinking. I'll put that out there for everybody to chew on, but that's why I didn't go there, because I thought, it could be one issue that we bring up in a plethora of issues that we all talk about, like a half-day retreat or a full-day retreat, or whatever you want to call it. Thank you, Mr. Chair.
Thank you, Commissioner Maddox. And part of what you're talking about has the format of the mayor chair, superintendent chair meeting, which I understand does not satisfy what you're talking about, because the whole idea is, as you stated, and Commissioner Dozier has stated, is to get the two commissions and the school board together talking about issues to get together, right? Many of the issues that you're talking about that we would discuss at this type of workshop have been touched on at the mayor chair, superintendent chair meeting, but obviously there's not that multilateral interaction with us as elected officials. So I understand what you're saying. Any other comments? I do have Commissioner Dozier in the queue, then Vice Chair Proctor and Commissioner Welch.
Thank you, Mr. Chair. To clarify this, and Commissioner Cummings, I'm going to get a little closer to the mic. I know the masks and the plexiglass are difficult. So I guess I like the idea of having more dialogue. I'm a little bit of tongue in cheek. I'm always up for another good discussion and meeting, but a lot of folks don't want to have more meetings right now. So trying to be a little more strategic about this. It's a good idea, Commissioner Maddox. I think for our purposes with this item, and this is also in response to Commissioner Cummings, your question, several years ago, it really came to light, and I think it may have even been a CRA discussion when the county was still on the CRA board, that we had parallel housing programs and not a lot of resources in our community, and it would be better if we align some of our work to maximize the collaboration and bring in our partners like Tallahassee Lending Consortium and Habitat for Humanity and others. That conversation happened. We had a joint workshop. I think it might have taken us a while to schedule it, but we got it done. And then both commissions took separate action on similar items. We established the committees that meet together. the land trust and other things. So really my thinking here, we have an issue of homelessness, but a lot of it is about transitional housing and permanent supportive housing, trying to get people into homes. Well, that is also a housing question and an affordable housing question. So we made good progress years ago. We've got COVID, a lot of other challenges, but we're all talking about housing issues again. The city had their workshop. We have ours coming up. So the thinking was maybe it's time for an update, for the 12 of us to come back together to focus exclusively on how are our housing programs going. That's why this study with the Escambia County and Florida Housing Coalition was so intriguing to me. We don't know what we don't know. Maybe we're leaving money on the table. Maybe, I mean, we're doing a lot of good things, but let's push the envelope and try to address this issue. So, Commissioner Maddox, to your point, I'm good with another kind of meeting for our purposes right now. I'm solely focused on a update, joint housing and transitional, all types of housing workshop. We don't have a motion on the table, but I'll leave it there for the discussion and then come back and make a motion if we're interested in suggesting that for our city colleagues. Thank you, Mr. Chair.
Thank you, Commissioner Dozier. I've got Vice Chair Proctor next in queue. I want to try to remind everybody, let's please keep things brief and succinct as much as you can while still retaining the content of what you want to say. And then also, in case you've thought about it, we're not going to break for dinner. We don't actually have dinner prepared for this evening. So there's no break upcoming, unless, of course, you all decide at some point that you want one. For those of you that may have fasted with the citywide fast and prayer yesterday, it was a little painful. I don't want to go through that again today. So I'm just asking you all to please kind of hurry up with your succinct comments. Vice Chair Proctor.
Thank you, Chairman. I think it's very simple. I think our at-large commissioners have put this low enough that even I can tiptoe up to it and can get an understanding. It's a good thing to have all layers of government, to have a round table at large. I certainly, as I think of the homeless issue, sometimes childhood homelessness is disguised, but nobody has the data like the school district. And certainly I know that Commissioner Jackson can back me up when we say there are certain schools that children, they play musical chairs and they transfer 3 or 4 times a year to different schools. But housing, their parents are moving and trying to pay rent and keep things going. And a whole lot of children in certain area schools are not homeless, but they're not stable in homes, if that makes sense. So there's a lot that the school can tell us, not only demographically, but about the peculiar realities of youth of homelessness and destabilized homes. I'm certainly curious as well, and I don't want tough subjects off the table, but I am curious about the 2 different school districts that we have. One where 70% of the children don't read at grade point average, and then there's another school district. We fund it. We raise and levy the taxes to support the schools. They do too. And our monies, and the fact that in my district, 70% of the kids don't read at grade point average, I would love to hear, because I'm asking every year citizens to give us that money, pass through to go to the schools. And that's one of the reasons I almost want to vote against the budget every year, but I don't have any way of knowing specifically why so many kids can't read at grade point average, and specifically our Title I schools in District 1. Thank you.
Thank you, Vice Chair Proctor. Okay, seeing that there's no motion on the floor, we'll continue to the next item. Mr. County Administrator, would you please introduce it?
Thank you, Commissioners. Mr. Chairman, the next item seeks the board's full appointment to the Tallahassee-Leon County Board of Adjustment and Appeals. Option 1 provides a name for your consideration. We have no speakers on this item.
All right. Seeing no speakers on the board, all those in favor of the motion as stated by Vice Chair Proctor Commissioner Maddox made the motion, Vice Chair Proctor seconded. All those in favor say aye. Aye. All opposed? Motion carries unanimously. All right, Mr. County Administrator, just to confirm, there are no scheduled public hearings, is that correct?
That's correct.
All right, and then are there any members of the public who would like to speak on non-agended items?
We have no speaker cards.
Great, thank you. All right, our next order of business is items from the County Attorney. Madam County Attorney.
Thank you, Mr. Chairman. I have one item for the board's consideration this evening, and that is consideration of a proposed settlement agreement. By way of background, the county has been in dispute with a contractor, Barclays Security Services, regarding its contractual obligation to identify, defend, and hold harmless the county against claims for damages brought against the county as a result of alleged misconduct of a Barclay employee. The county filed suit to enforce the obligation, but I'm happy to report that I have a proposed settlement agreement to present for the board's consideration with a recommendation for approval. Under the terms of the proposed settlement agreement, Barclay agrees and acknowledges that the individual alleged to have engaged in the conduct at the time of the incidents was a Barclay employee. Barclay agrees to accept responsibility for all amounts paid either by way of settlement or judgment on plaintiff's claims against the county, together with attorney's fees and costs incurred in defending the plaintiff's claims. And Barclay also agrees to accept responsibility for any amounts paid either by way of settlement or judgment on plaintiff's claims against the county, together with attorney's fees and costs incurred in defending against the plaintiff's claims. Finally, Barclay agrees to pay the county and its insurer for all legal fees, costs, and expenses incurred to date that have resulted from, arisen out of, or related to the underlying litigation and the county's claims against Barclay. Going forward, they also agree to pay outside trial counsel retained on behalf of the county as outlined in the settlement agreement. Based upon these terms that I've just described to you now, again, I do recommend approval of the proposed settlement agreement.
Commissioner Dozier.
With thanks to the county attorney and her staff for working on this issue, and I'd say 2 settlements in 2 months, pretty darn good. I'll make a motion to approve the settlement.
All right, is there a second on the motion? Second by Commissioner Welch. Any other commissioners wish to speak on the item? All right, seeing the motion made by Commissioner Dozier, seconded by Commissioner Welch to approve the settlement as recommended by the county attorney, say aye. Aye. All opposed? Motion carries unanimously. Thank you, Madam County Attorney. Any other items?
No, Mr. Chairman, thank you.
Thank you very much. Next, we have items from the county administrator.
Thank you very much, Mr. Chairman. And Mr. Chairman, I'm going to hand this item to you. If you would pass it down. You all know that this is not something that I do very often, but I've got an agenda item based on what you just heard from the county attorney's office. And thank you to the county attorney for this settlement. It enables us to act now on the proposal which is before you. You may recall that at your or a couple of meetings ago, you awarded to a lowest responsive bidder for security services. That lowest responsive bidder was not able to meet some of their obligations related to insurance and others. The next lowest, and now, based on the settlement, responsive bidder was Barclay. Now that that issue is resolved, I've got an item before you that is seeking your authorization to authorize me to negotiate and execute an agreement with Barclay off the state term contract, subject to legal review and contingent upon the pending settlement of litigation between the county and Barclay Security Services. Happy to answer any questions on this for you, commissioners, but again, in the interest of efficiency, I wanted to provide this to you tonight. And again, just happy to answer any questions that you might have.
Commissioner Cummings and then Commissioner Dozier.
Oh, I'm sorry. Mr. Chairman, I move option 1.
All right. Thank you, Commissioner Cummings. Commissioner Dozier, any comments?
I'm sorry, that was a motion to
approve option 1.
All right. This may be exactly the right thing to do, but I can't support the motion today. If I remember correctly, in response to the bid, Barclays actually said there was some discrepancies on their bid application, some things that they meant they were not, it wasn't just the settlement that was out there, it was the documentation they provided may not have been 100% in order. Is that correct?
My understanding is it was the settlement issue, which was the primary reason that they were not responsive or not eligible to receive consideration for the bid.
That they did not acknowledge that they were in a lawsuit was also an issue. Is that correct?
I may have to defer to the county attorney on that one.
Madam County Attorney.
Thank you, Mr. Chairman. A requirement of the bid submissions was the inclusion of an affidavit attesting that the bidder was not involved, did not have a breach of contract claim or dispute pending related to a breach of contract claim. Barclay did submit that affidavit.
Okay. Again, this may be exactly the right thing to do. I may be able to get there at the next meeting. Kind of wish we had a meeting in 2 weeks because I know this may be time sensitive, but we'd have to wait a month. I'm just not comfortable with an agenda item coming down the dais. Mr. County Administrator, I understand the challenge that you got right now with the last bidder, the one we approved, not being able to come in. I think you had a temporary solution, and I would also understand you don't want that temporary solution to go through the next month. I'm just not comfortable with the information being distributed, without being able to go through this in more detail. And I will leave it there, Mr. Chair. Thank you.
All right, thank you, Commissioner Dozier. Any other comments? Seeing none, we'll go ahead and we'll move to the vote for motion made by Commissioner Cummings, seconded by Commissioner Jackson for option 1. All those in favor of the motion signify by saying aye. Aye. All those opposed? Okay, the motion carries 6-1 with Commissioner Dozier in dissent. Any other items for the County Administrator?
That's all for me, Mr. Chairman. Thank you.
All right, thank you very much. Moving on to discussion items by commissioners. We'll mix it up a little bit this time. Vice Chair Proctor.
Mr. Chairman, Mr. Chairman, could you come back to me? I'm awaiting some information.
Of course, sure. Commissioner Maddox. All right, thank you, sir. Commissioner Dozier.
Mr. Chair, we have talked about homelessness and housing a good bit. I did want to acknowledge and thank County Administrator and your staff for bringing us back the cold night shelter policies and procedures so quickly. That was on our consent agenda, and really happy with where that item landed. Do we know when the coordinated program that planning staff is working on related to homelessness and the siting of shelters might come back to us? If you don't have an answer right now, that's fine.
Alan, I'm looking to you on that item.
It's fine, guys.
Yeah, I think we said April or March for that item coming back on the, yes, the planning.
Yeah, they're meeting on it right now. It's going to be April or May, depending on the final timing. We're coordinating with the city right now on that.
You're coordinating with the city in April or May is what you said? Okay. That just flows into everything else we've talked about, and I'm sure we're all aware the DRC met yesterday regarding the City Walk issue. So this coordinated plan is really going to be important to prevent, hopefully, instances like that from coming up in the future. So other than that, Mr. Chair, I already said it earlier, but you did a fantastic job at Legal Services in North Florida. And it is extraordinary that we are actually coming into spring break. So for those incredibly hardworking principals and teachers sitting on the dais and everywhere out in Leon County and all the students, I really hope everyone finds a safe and nice way to take a break from this difficult year at school and enjoys the spring break. Thank you, Mr. Chair.
Thank you, Commissioner Dozier. Let's see. Commissioner Jackson, sir.
Thank you, Commissioner Dozier, for the well wishes, but unfortunately play the sad tune. Principals have to go to work during spring break. But I bet I have some leave time built up, so hopefully we'll find some time. That's for Commissioner Welch and I to sneak off and catch some fish somewhere. I did have one shameless plug for the Fort Braden Community Farmers Market. Hopefully Matt can help me with this, or Mr. Administrator, you may want to answer the question. We have our first annual Fort Braden Farmers Market this Saturday out at the Fort Braden community. It's being housed at Lake Talcott Baptist Church. It's outside. Over 20 vendors are coming. That's not bad for a first try. Lots of fresh vegetables, homemade goods and other assorted goodies is what the details say here. A product of one of our community advocates, Miss Hannah Crow, and she's been in contact with Matt. I don't know that we have it advertised on our webpage or if we're allowed to do that, but it looks like the county administrator said we could. And with that, I would encourage you to go out and visit our fbcommunity.org website. It talks about a lot of issues going on in the community, most of them celebrations and positive things, and then plans for the future. I'm excited to have some real impetus and some drive from some of our community residents, and met with them a couple of weeks ago and look forward to some things coming to fruition out that way, possibly even an expanded walking trail in the near future. So thank you. That's all I have, Mr. Chair. Fine meeting. Great job.
Thank you, Mr. Jackson. Really appreciate it. Vice Chair Proctor.
Thank you, Mr. Chairman. Commissioners, I early in the meeting left our meeting very disappointed. I wanted to go and retrieve the Center for Disease Control and Prevention, their recommendations for the nation. Our Director of Health indicated that here in Leon County, our prison population was just not a priority. And she indicated that they were absolutely following the CDC guidelines and said that we go by guidelines and this, that, and the third. And clearly, if they're going by the CDC guidelines, and she says that our inmate population is not a priority, I've put it in your hands. And jurisdictions, this is reading from the CDC, it indicates that jurisdictions are encouraged to vaccinate staff and incarcerated detained persons of correctional or detention facilities at the same time because of their shared increased risk of disease. Outbreaks in correctional and detention facilities are often difficult to control given the inability to physically distance, limited space, blah, 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 over to the next page. What I've shared with you, commissioners, is about 4 pages worth of guidelines that are all much, much different from what we've heard coming from. I'm disappointed. And it's just hard to have faith in a situation that we are currently isolated from guidelines. And even though the director said that that's what she was abiding by, again, I say publicly, she was lying. And the state is not abiding by them, and our governor is not abiding by them. But the fact that she has been extracted from, and under the previous president, our governor and the previous president were aligned against the CDC in the politics of it. This underscores why what Matt presented tonight, the motion by Commissioner Cummings tonight to get on the street quick, fast, and in a hurry is because we are not under CDC recommendations and nobody's even trying. And to say, and for them to say that there's encouragement to vaccinate staff and incarcerated detained persons. And it goes over further to talk about the sub-prioritization planning for vaccination within groups. But nowhere does it say that people are not a priority. It's just not there. So because my name and honor means something to me, and I don't want to call down, pull down, drag down anybody else's name and honor without standing on the facts. This is why I went and got that policy to share with you specifically what the CDC is saying. We have to go forward because we have no help. There's nobody else but us. So thank you again, Commissioner Cummings. We on our own. Thank you, Vince, for your leadership and your forward goingness. I'm just very, very hurt and crushed tonight because, as I've said earlier, my son is incarcerated, and for the director of health of the capital of Florida to say that is not a priority to get a shot, and the CDC says it very much is an amazing thing. I've lost confidence in her. Secondly, commissioners, and finally, I'd like to just, I know that we looked tonight at the issues of diversion programs, and I wanted to ask several questions, not for long, but those questions had to do with what are the impacts? Is the state attorney tracking diversion? What are the racial demographic on pre-arrest? Where are we with respect to the thing we had with this village, the thing that Jameis Winston had, civil citation, and all of that? How is it being administered? Is it still being adhered to? Where are we with marijuana in the issue of making that a civil citation, and all of those things to keep our jail low? When, and it's very important, when the people in a jail are not a priority, we have to keep people as many out as we can. And so I am interested, Vince, and I know item 15 attempted to tell us a lot, but I think it's worthy at this time, given the absence of prioritization of people's lives under our care. It is absolutely, we're compelled to look at diversion and get into the intimate detail as to what is happening, what is not, and does diversion impact the actual presence of citizens who are incarcerated. So moving forward, I'm just asking that that diversion look narrows in, and in particular, as it impacts those numbers, race, and accordingly, I thank you, commissioners. I love this commission. Exciting work here tonight. Thank you for your leadership, Mr. Chairman. Thank the county attorney and county administrator for, as Commissioner Dozier pointed out, another big win in settlement for our county. You know, Nick doesn't know this, but, you know, women's voices, Mr. Chairman, can get things done, just that tender thing, and Nick, you should remember that. I'm not going to charge you for that advice. And our county attorney has made it happen one more time. We're grateful. That being said, I'm grateful to live in Tallahassee, notwithstanding a lot of the constraints. Shouts out to Florida A&M University. It was a historic deal. The Nike, LeBron James, and Florida A&M athletic agreement, whereby Nike will support its 14 athletic teams and the marching band with apparel and support. Humongous. And shouts out to Dr. Robinson and Florida University community. That being said, I thank you so much, Mr. Chairman.
Thank you, Mr. Vice Chair. Commissioner Welch, how about you?
Thank you, Mr. Chair. So just wanted to say continued thanks to the county administrator and his staff, Madam County Attorney, for you guys keep answering my phone calls, which is, I appreciate a lot. I know I'm calling a lot and trying to learn and trying to figure out, how to get things done. Also wanted to thank Brent Pell and his group in Public Works. I have I feel like I've public worked them a lot. They have done a lot in my district over the past month. I'm going to try and highlight a department every month that I have some commission time, and they rebuilt a turn lane at the entrance to Summerbrook and put a bunch of granite down on Pisgah Church Road. And also, as a part of our efforts to sort of create some pedestrian safety in the Northeast, specifically raise some curbs on Deer Lake Road. So kudos to our Public Works Department, who seem to be super responsive. Called them today about some mowing over near Westminster Oaks, and they were quick to respond and get that on the schedule. So thank them. Thank you, Mr. County Attorney, again for getting our mobile testing sites into the Northeast for COVID. Those have, like we discussed, fortunately gone down in their volume, which is a good sign. And so other than that, that's all I have. Thank you.
Great. Sounds good. I agree. The Public Works Department is second to none. So terrific. Commissioner Cummings.
Thank you, Mr. Chairman. Just very briefly, I believe all of us received an email about designating Leon County Library as a regional library. And I'd just like to move that we ask staff to just look into that, do an analysis. I'm not sure if there's any costs involved or just what's involved. But I'd like to move that we ask staff to review and do an analysis and just come back in the future with recommendation or report in that regard, Mr. Chairman.
Okay. All right, ma'am. Thank you. Is there a second on the motion? All right. Motion is made by Commissioner Cummings and seconded by Vice Chair Proctor. All those in favor of the motion say aye. Aye. All opposed? Motion passes unanimously.
And then lastly, Mr. Chairman, I'd just like to thank the boards for the support that I believe that we've all demonstrated, that we are concerned about all citizens, especially the vulnerable population here in Leon County. I can't say enough about the staff, the county staff, our county administrator, Long, and our county attorney, and all those individuals that work hard every day so that we can show that we are sensitive to all the citizens in Leon County. So thank you for your support. I thank my fellow commissioners for their support on the initiatives that were raised tonight.
Great.
Thank you, Mr. Chairman.
Thank you, Commissioner Cummings. I'll go ahead and I'll wrap it up. Commissioner Jackson, do you have a word to say?
Sorry to go again. I mistakenly forgot to give a shout out to our brand new homework hub through our public library system. It has been well used by many students under my watchful eye, and we look forward to clogging the lines in the near future. So great effort, incredibly innovative, and super important at this time when we still have many learners at home. And I just can't say enough about that. That is exactly the type of programs, Commissioner Proctor, you talked earlier about closing the gaps. That sort of thing is what allows homework help and gets folks that have other priorities and are out working the possibility for their kids to be successful and achieve at high levels. So way to go, Homework Hub.
Thank you, Commissioner Jackson. Thank you for pointing that out. That's really great news. That's a testament to the county administrators, staff, and the library team, Deborah Sears and everybody else. So congratulations. Great news to hear. I'll be very quick. I'll be quick as I can. In December 2019, those of us that were here at that point, we had an agenda item about a burning ordinance and what we could do to kind of help make the balance between folks that have the right to burn recreationally, et cetera, and folks that might live nearby that might suffer the consequences of smoke coming onto their property. Well, since that time, it's been over a year. The folks that originally approached us, the constituents that had the concerns about that, are still enduring their neighbor that is burning near constantly. All types of yard waste and other things in that yard. We've had another constituent and their neighbors come to us about the similar concerns. After some discussions with the county attorney and her consultation with the city attorney, as well as the state, there's been a consensus that, frankly, the Florida Forest Service preempts local governments from making any type of changes to the burn ordinance. And it also mandates that the Florida Forest Service is the enforcement entity of those of fire ordinance of fire statutes, which means that our fire department actually can't go by law and investigate and make a judgment on burning. I've been asked by some of those constituents to take a look at any type of things that we can do that might alleviate the quality of life issues that they're having. County attorney has asked me to seek your approval to basically ask her to spend some time within her office to take a look at, not the burning ordinance, because we know that we're preempted on that, but there may be some sort of smoke nuisance that transcends property lines that might be able to give us some relief for these constituents. Similar to like a noise or nuisance ordinance or something where you might have contaminated water that goes from one property to another. And so with that, I'd like to seek your approval. I can't make the motion myself, but basically to ask the county attorney's office to take a look at what possible alternatives there might be. We're preempted from the burn ordinance, but if there are other opportunities regarding protecting the health of these neighbors that are experiencing this type of issue. Yes, Commissioner Dozier.
If the vice chair had something.
Why don't you go first, and then Vice Chair Proctor, if you would.
Thank you, Mr. Chair. So I got to back up a second because we have a burn ordinance. I mean, the discussion we had 2 years ago, 3 years ago was about strengthening that, and there were some other related questions. But are we saying that that ordinance isn't valid? Is that what we have found?
The county attorney and I have spoken at length about this. Let me refer it to her, who can explain it.
Thank you, Mr. Chairman. So, Commission, the ordinance that currently is in place and has been since 2015 actually says that it delegates authority to the state, when in fact, we can't delegate anything because we're preempted. So it is effectively correct, but we do need to, and I plan to come back at a future meeting as a cleanup item to request a public hearing to modify the ordinance or frankly repeal it, because we don't have the ability to adopt any standards other than what's currently provided for in state law under the Department of Agriculture and Consumer Services and their rules, which also incorporate by reference DEP rules related to burning. So that is a cleanup item that will come back to the board in the future.
My request to you, just on point, is to allow the county attorney to take a look at what other options we might have to protect the health of constituents. We can't do anything about burning, but we might be able to find a way where we could make some type of policy on smoke that goes from one property to another.
I hear you, Mr. Chair. This has been an issue that has come up every couple of years. We have major health challenges. The last time I brought it up a few years ago, it was actually after Hurricane Michael, and we had people burning a lot on their properties and other people without power who had health challenges and they had their windows open. So there's some counties in Georgia that had a moratorium on burning during emergencies. So we've looked at this issue from a lot of different angles. This is fascinating to me, and I'm just wondering, Mr. Chair, if we could wrap these two issues together with the county attorney's analysis of the existing ordinance and exploring smoke and other issues, because the enforcement, if we did find something else about nuisance smoke, as I think what you said, we would have an enforcement question, and that has come up in past discussions as well. So I'm fine with moving forward with an agenda item. I'd make the motion for you, but I'm wondering if we can piggyback it with an analysis of the burn ordinance. The two may be related.
That'd be fine. Based on the conversations that the county attorney and I have had, I think the amount of, I can't speak for the county attorney's office, but I believe that the effort required would be minimal because a lot of that work has kind of already been done to analyze the burn ordinance. So I can't make the motion myself, but if you'd like to make a motion to that effect, I would second it.
So bringing back an item that's already in progress to cure the burn ordinance issue, as well as exploring any options for nuisance smoke or anything else that could help us with the health challenges. Is that correct?
Yes. I mean,
okay.
Listen.
That's my motion. We need a second.
Okay.
Mr. Chair.
Second. I'll second it.
Okay.
Any other discussion?
Question.
Vice Chair Proctor.
Does the county attorney find that the city's ordinances are likewise suspended or preempted, just as the county's burning ordinances are preempted by the state?
Madam County Attorney.
Thank you. So, yes, and the city is in the process of addressing that issue. So when the county changed its ordinance back in 2015, and by the way, the provision of the statutes that changed to effectively preempt our ability to set different standards was enacted in 2011. But so when we adopted ours in 2015, the city started taking efforts to modify its ordinance to be consistent with the county ordinance. Priorities, it takes a little time. It recently came up on their agenda again, and in the course of reviewing that, they made the determination that they thought that provision that had been basically, that became law in statute in 2011 preempted, which is when we got together with the city attorney's office and the general counsel's office at the Department of Agriculture and Consumer Services, and all reached consensus that in fact that is the case. So the city is going to address its ordinance as well, is my understanding.
Thank you, Madam County Attorney. Any other comments, Vice Chair Proctor?
No, sir.
All right. Motion's been made by Commissioner Dozier and seconded by myself. All those in favor of the motion as stated, please say aye. Aye. All opposed? Motion passes unanimously. Thank you all very much. Also wanted to ask you all for a motion for a proclamation for the Big Bend Honor Guard, which serves the Tallahassee National Cemetery. These are folks who participate in the funeral ceremonies that take place on the property. On March 26th in the evening, I'll get you the exact time, they're going to have a ceremony at the American Legion local post to honor these Honor Guard members and present them with the American Legion Presidential Medals. And so we are all invited to go to that. But I'd also like to ask you for a motion to issue a proclamation to honor them. I saw Commissioner Welch first. Thank you, sir. And then second by Commissioner Dozier. Is that?
I just wanted to say, Mr. Chairman, I think that's a great idea, and I would make the motion or second it. Thank you.
Great. Thank you, Commissioner Welch. Commissioner Welch has made the motion, seconded by Commissioner Dozier. All in favor, say aye. Aye. All opposed? Great. Thanks. And we'll let you know the details of that event on March 26th. But I think it'll be great if we can go. Two more things real quick. Last week I met with the leadership of the Greater Tallahassee Chamber of Commerce, and they've had some discussions within the chamber there, as well as with the county administrator. They're interested in taking a look at the metrics that we use to measure the health of the community overall, not just economics, but also along a whole host of issues. So I think the county administrator is working with them and OEV. I've asked them to reach out to the Big Bend Minority Chamber of Commerce as well as the Capital City Chamber of Commerce and see what type of consensus we can reach out to. But just wanted to let you all know that that discussion has taken place. And I believe, I don't want to put words in your mouth, but I think the county administrator said there might be a presentation in April. Is that correct, sir?
That's correct. That's what they've requested.
Okay, great. Thank you. And then lastly, I just wanted to acknowledge the passing of Dr. Pamela Hall. As I'm sure you all know, she had a big struggle with cancer and passed away on February 22nd. And I know many of us have met with her, in my case, the last couple of years, but I know some of you met with her for many years. And I'll leave it with this. Former County Commissioner Gary Yordan said it really well. He called her a remarkable human being and a great environmental warrior. So just wanted to acknowledge the passing of Dr. Hall. It's a sad day when that happened. But and with that, my comments are concluded. Anything else from anybody else? All right. Do I hear a move to adjourn? Motion to adjourn. Thank you very much. All in favor say aye. All opposed? Great. Thank you all very much. Have a good evening.